I just started the live stream.
This is an insanely large packet. I feel bad that Wendy had to print it for me.
I get them printed for every meeting. Because I check them off, I read them all and I initial it if I don't have it initialized.
Well, I review it on PDF, but with doing Zoom, it's too tricky for me to do the PDF and we got some feedback here. You can hear us.
We are live on YouTube.
Okay. We're getting feedback, like when I'm speaking, I'm then hearing it.
I think that's his computer feedback.
Perfect. Thank you. Yep.
Do we have 7 commissioners though?
1, 2, I don't think so. 3, 4, we're
I got
missing.
2 more in.
We have 2 in the waiting room that Sean is adding.
Okay.
There's Pro Tem Hill. Hi, Jen.
The staff that's on there is just there in case there's a question.
Okay. Hi, Evan.
We got Jerry, Dr. Lawrence, and Matt Curtis.
Okay. I see them now. Sometimes it's hard. Oh, it's 6 o'clock. Look at that. Give me 1 second, folks. I'm juggling multiple screens here.
We might have to get Chris Hazard's back.
All right. I'm getting there. Almost there. Just wanted to make sure that I could see all of your wonderful faces. I think I have in the right view now. Okay, we will go ahead and get the meeting started. Looking for the gavel. Coming back. Hang in there. Okay. Call this meeting to order at 6:01 p.m. This is the Monday, November 30th, 2020 meeting of the City Commission. Please join me for the Pledge of Allegiance, and go ahead and unmute the Pledge of Allegiance if you'd like. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. City Clerk, could you conduct the roll call, please?
Commissioner Bonzal? Here. Commissioner Davis?
Here.
Commissioner Hanley?
Here.
Commissioner Mayer?
Here.
Commissioner Stonehouse?
Here.
Mayor Pro Tem Hill?
Here.
And Mayor Smith.
Here. Thank you. Commissioners, we have an agenda. Do we have a motion on this agenda? And I would ask commissioners, raise your hand if you would like to make a motion or a second or a comment. Commissioner Stonehouse?
I motion to accept the agenda as written, Your Honor.
Thank you. Do we have a second? Commissioner Davis?
I'll second that motion.
All in, any discussion? Sorry about that. I don't see any discussion. All in favor, please say yes.
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 All opposed, please say no. Motion passes 7-0. So as we're holding our meeting on Zoom, I just would like to remind commissioners to please raise your actual physical hand if you'd like to speak. If I somehow missed your hand, please feel free to unmute or speak up. I know that happened one other time on Zoom, and I just want to make sure, go ahead and just, say excuse me and go for it. And you don't have to remain on mute the entire time. I just
I heard some pretty significant background noise at the beginning of the meeting, so that's why I asked folks to do that. Thanks for your help. Commissioners, we have one appointment on our agenda. Do we have a motion on this appointment? I'm looking. Commissioner Davis?
I'll move to appoint Eric Kazarzik, I hope I pronounced that right, to the Downtown Development Authority for an unexpired term ending in 1/1/24.
Thank you. And do we have a second on this appointment? Commissioner Bonzo?
I'll second that motion.
Thank you. Commissioner Davis, any discussion? Commissioner Bonzo? Any other discussion? Sorry. Getting used to Zoom again, guys. It's a little different. All in favor, please say yes.
Yes.
Yes. All opposed, please say no. Motion passes 7-0. We also have one reappointment for consideration. Mayor Pro Tem Hill?
I move that we reappoint Tony Tollison to a term to the Marktran Board expiring December 31st, 2023.
Do we have a second? Commissioner Mayer?
Second.
And any discussion on this? Or Mayor Pro Tem Hill, anything?
Just appreciate Tony's long service and look forward to the opportunities they find in the upcoming years. Transit's really important.
Commissioner Mayer? Any discussion?
Nothing further to add.
Great. Any additional discussion? All in favor, please say yes.
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 All opposed, please say no. Motion passes 7-0. Brings us to public comment. Public comments may not exceed 3 minutes per person. Do we have anyone for public comment this evening?
We do not, and I received no written comment.
Okay, we do not have any public comment, and we received no written comments. Public comment is now closed. We do have two presentations this evening. I'm looking forward to both of them. Up first, we have Jerry Masana, Health Officer from the Marquette County Health Department, along with Dr. Bob Lorenzer, who's the new Health Director for our Health Department. And I just wanted to say thank you to both Jerry and Bob for joining us this evening, and let them go ahead and take away the Zoom presentation whenever you guys are ready.
Okay, thank you, Mayor. I appreciate you having us on today. Dr. Lawrence is also on. I sent a few slides. I think in the past you guys have seen, the global, the national, the regional, and the local, but at this point it's pretty rampant. So I'm going to stick to just kind of some local numbers here. We also have some information on the hospitals and then local hospitals, and then Dr. Lawrence put together a little summary regarding vaccines, which we figured might be a concern or a topic of conversation here. So I guess without further ado, I would like to just kind of zip through the slides, and I will remind you that these slides are also on the MQT MaskUp dashboard, and I'll just take you guys to that just real quick after I go through them, but I couldn't print from the dashboard, so I just recreated these real quick on an Excel spreadsheet. So, and these are some of the key indicators that are looked at among the community, among the schools, among key leaders. So the first slide here is the Marquette County test positivity and the average test per day by week. So these are running from
Jerry, just one moment. I think we want to make sure that we share the screen and we have that data up so the public can see it as well. Great information. And we just have a little bit of tech catch up to do here. Can we share that?
I can. Yep. Let me hold on. I can do it.
Okay. You can share, Jerry. Perfect.
Yep.
And I really do appreciate that new dashboard. It's been up for a few weeks now, and it's an excellent resource. Thank you for putting that together and getting it out to the community.
Hold on, so let's do this. Okay, can you see the slides?
Yes, thank you very much.
Okay, so what I sent you guys is a PDF, but this is from a Word document because you can hover on this and see some of the numbers. So the first slide, the first graph is the test positivity and the average test per day by week. And you can see that we have come down a little bit. You look, if you hover over here, we're right about, basically our positivity rate is at 8.18, and it was over 10 on the previous week. And I think what you can see here is the fall off of Northern Michigan doing their testing, because they had been doing testing, random testing of students and athletes up until last week. And I think last week they just did some athletes. So you're going to see the averages come down in terms of the testing, because of their students have all now gone home for the semester. Not moving here. Hold on. Give me 1 second. Can you guys still hear me?
Yeah,
Okay.
we're able to hear you, and I can see, well, I could see the screen share. It looks like it disappeared now, but we saw the first chart, and it looked like the second chart was kind of up and coming, but I think we'll have to have the
Yeah,
screen
screen share
reshare.
has stopped because of the external display is disconnected. So let me see here. Let me try this again. Am I working now?
Yep, perfect.
Okay, so the second graph here is Marquette County cases by month. And you can see this is actually data through November 28th. So we spiked pretty high in October, and we're exceeding that in November, and we still have 2 days. This is the 28th, so we have the 29th and the 30th that will be added to this. So we're going to be some pretty high numbers in November as well. And then the next graph next to that is cases by age group. And this has been pretty typical right along the line for the last several months. The 20 to 29 age group has kind of led the pack in terms of the positivity. This graph here only gets updated once a month, because we actually have to go into the MDSS, the disease surveillance system, and grab birth dates out of there, because that information isn't published on the state websites or any other websites. So we actually have to mine this data. So the next time we publish this graph, you will see the November, the number averages for cases, positive COVID cases in November. This is the next graph is total confirmed cases. And right now, as of November, as of November 28th, we're at 2,533 cases in Marquette County. And you can see that it really spiked up since, I don't know, the end of September, kind of rolled right up. And I guess the next slide is something that really is kind of concerning. This is deaths. And you can see for about the first 30 weeks, we only had 12 deaths up until maybe the, the middle of October. And then in the last 6 weeks, we've gone up to 30. So we more than doubled deaths in a matter of 6 weeks. And that was quite a rise. We are still seeing the deaths are in the older populations. And of course, that's the people that we're trying to focus on in terms of social distancing. And that's some of our targeted advertising and media is to make sure that the vulnerable are kind of protecting themselves with social distance as well as masking. The next slide here is an average 7-day rolling average. So the bar graphs, the blue bar graphs, are the cases per day, and the red line graph is the average cases per day on a 7-day rolling average. And this is based on onset. So in explaining this graph, you can see that this is the 28th of November. So when we get a test in, we go back and we look at the date of onset of symptoms. So as we get tests now, today and tomorrow and the next day, they might say, well, their onset of symptoms is the 28th. And then these bar graphs here will fill in as we get data on positive tests. So that's about a 7-day lag, usually could be up to a 7-day lag, because of the time that people go to get a test, get tested, wait for the results and come back. And actually it could even exceed that. But I guess at the high point here, I will say that our positive or our 7-day rolling average that we're seeing about 65 cases a day on average, and that was through probably the middle of last week, which is a pretty high number for us. And then the last graph here is the cases per million, which is pretty typical among the state. Again, this is based on onset date as well, and you can see that over here that we are exceeding 1,000 cases per million. So the way that number is calculated is you take the number of population. So we're about 67,000 people in the county of Marquette. So you take 1 divided by 67,000 and multiply that by 1,000,000, and it comes out to 1 case actually is about 15 cases per million. So you can see that if you take 15 times 65 average, that you're right in that 1,000 cases per million range. So I don't know if anybody has any kind of questions on the local graphs here. I do have, so this is going to be a little piecemeal, but I do have some regional data that I was able to grab. You guys don't have this slide, but I'd like to look at the hospitalization first, unless there's some questions about these graphs. Yes, Jen?
Looks like Commissioner Davis has a question.
Oh, I'm sorry.
You actually see me. Okay. Jerry, thank you so much for this information. You highlighted the increase in the number of deaths since October 15th. And I'm wondering if you have, or Dr. Lawrence has a feel for why that has increased so dramatically.
Nursing home deaths.
Okay. So are we seeing another outbreak in nursing homes?
Yes.
Okay.
Multiple nursing homes, actually.
Okay. Thank you.
Mayor Smith? I don't know if you can.
Thank you. Mayor Pro Tem Hill.
Yeah, thanks. To put the numbers, thank you to both of you. This is really helpful. To put the numbers in context, I believe there are measures for both the positivity rate and the cases per million rate that are used to identify whether you're in community spread or you're moving down in a better situation. Could you maybe put those numbers in perspective of how they look in terms of where we would be if we were actually improving instead of getting worse as we have in the past 2 months?
Well, I can tell you that the one thing I couldn't put on here is the risk levels. Okay, so just to let you know what the risk levels are in the state. So if you're over 150 cases per million, you're in the extreme. So we're 5 times that, 4.5 times that. And if you're over 3% on the positivity, you're actually over what the recommended is. But I think over 10%, if I'm not mistaken, on positivity is in the extreme as well. So as far as trends and looking down, I think if both of those are going up, so if your number of cases, the number of tests are going up and your positivity is going up, that's a sign of community transmission. That's a sign of, widespread community transmission. I don't know if Dr. Lawrence wants to add to that as well.
Yeah, we far exceed any critical level, along with many states, most communities. So we're right up there with the best. The community spread is rampant. That's why, the data actually says it's, if you look at outbreaks, when people talk about the nursing home outbreaks that we're having, yes, that is counting for almost all of the deaths. The cases are almost all community spread. So if we added up all our outbreaks, nursing home outbreaks, add up, I even have it someplace, but you add up the nursing home outbreaks, business, restaurant, bars, schools, they account for less than probably 10% of all the COVID cases in the UP. So the majority is at your friends and family.
Thank you.
So if I
Thank you.
can, Mayor Smith, I'd like
Yeah.
to,
We did have one other question here, Jerry. I see both Commissioner Bonzo and Commissioner Mayer have their hands raised. It's hard to see, but I was able to scroll through and see them. Commissioner Bonzo, do you have a question?
Yeah, I'll be brief. Thank you very much, Jerry, and thank you, Dr. Lorenzer, for this really informative presentation. It's certainly very concerning, and I really, really hope that we start seeing this gradual trend of things improving continue. I would be curious, I just had a request that it would be interesting to see an analysis perhaps in a couple of weeks when some time has gone by of what the impact of the statewide COVID-19 restrictions that were put in place recently has been in our local area. I think that would be really interesting to know. So if that would be possible for the county health department to put something together, a brief report. I understand that, correlation can't imply causation, but it would be interesting to see that correlation at least.
yeah, we can look into that. I can tell you what's also going to complicate that is the holidays, because typically, and we have seen that, Memorial Day, 4th of July, Labor Day, about 2 to 3 weeks after, we're seeing the spike, and that's kind of the incubation period. But, I would anticipate that you might not see a direct correlation because maybe it might go up a little, but if they hadn't done it, might have gone up a lot. So we can pull some data together. We'd be happy to, pull another presentation and try to draw some conclusions, but it's going to be complicated at least twofold between the restrictions and the holidays.
Yeah, totally understand that. I think it would be interesting to see for sure, but I think if you could provide that context to that data, that would be really helpful for me to see at least.
And then it looks like we have Commissioner Mayer had either a question or a comment, and then we'll go ahead and let them finish the presentation, and we'll come back with any more questions or comments afterwards. Thank you. Go ahead, Commissioner Mayer.
Thank you both. I just had one quick question. You're showing kind of how the 20 to 29 age demographic seems to be the largest proportionally. And what I'm curious is, are you guys finding that age demographic is more likely to go and get tested, and that could be partially a result of that, where older demographics maybe aren't getting tested as much? Or when you're looking at it, is it simply just that demographic is significantly higher?
Well, I'm going to ask Bob for some help here as well, but we are seeing a lot of that is the movement and the activities that are going on. I mean, if you look at the fraternities and the sororities and the colleges, and that is kind of in that lower grade. And I mean, I guess I don't have a better answer for you. Maybe Dr. Lorenzer does, but I think those people are more active, quite honestly.
It depends on who gets tested. So remember, this data also includes Northern's data that does a substantial part of the Marquette County. So Jerry just showed you a slide that when NMU drops off, our testing markedly drops off. The mean age, the ages that you're seeing is based on the testing. So whoever gets tested will actually, I think the younger people are getting tested more. And a part of that has to end up being the surveillance from NMU, who does a substantial part of the testing throughout the county. So you got to take a lot of these statistics, the data that we show you, with a grain of salt. A big grain of salt, maybe a whole salt block.
Thank you.
All right, Jerry, I know you were going to show us some additional slides or information, and then we can give commissioners another chance with any questions or comments.
Sure. Let me go to the, can you see the hospital data now?
You can, but it's pretty small. I'm not sure if you can zoom in or.
Let's see, I'm on 150. Let's see, let me try to do this. Hold on. This is also, I included this in the packet that I sent along. It was the last page.
That's better.
Okay, and I'll have to kind of scroll back and forth, but this is all the Upper Peninsula hospitals, and this is updated daily, so this will change tomorrow. So please don't take this as an everyday thing. This is updated daily, and this is reviewed by the hospitals, and we review this as well. But you can see that in the UP, there's a total of 560 inpatient beds, and out of that, there's 267 available. And so that's about a 52% occupancy rate. And of those people in beds, 75 of those are COVID or possibly COVID patients. So that's about a 28% rate. But what I would like to do is focus on Marquette here as well, because we're in the city and this is a city commission meeting. So 176 available beds, 137 occupied. So that's a 78% occupancy rate. And 28 of those patients are COVID patients, which is about a 20% of the positive of the inpatients are COVID patients. And then still moving over in the totals, a total of 58 ICU beds in the UP. You can see the line here, and 46 of those are occupied, and that's a 79% occupancy rate. And out of the 46 people in the beds, 22 of those are COVID patients or potential COVID patients. And with Marquette, there's 24 ICU beds. 22 of those are occupied, so they have 2 available beds, and 10 of those are COVID patients. I guess one of the things that's kind of concerning here as well is, you got Portage is 100% full. Keweenaw is 100% full. Ironwood is 100% full. So where are those patients going to go? For ICU patients, it's kind of hard to push them around and move them to other places when the others are full. So the rates are high. So the rest of this data is just like before the previous data. So out of the 46 patients in there, 22 are positive, and so that's a rate of 48%. And this is just some history data over here. So again, this is published daily. It's through a program called EM Resource, which is just accessible to healthcare providers. But we can get this data when we request it. The hospital gives it to us upon request as well.
Jerry, I have a quick question. This is Mayor Smith. If you could scroll over to the right where it says HHS, I think it said daily deaths. Are those COVID or any deaths? I'm just curious. It doesn't say COVID, so I wonder if it's just a general.
That's a good question, Mayor. I think those are HHS, that's Health and Human Services. I don't know. I guess I can ask the question.
I'm pretty sure it's the deaths from the hospitals, from the Department of Health and Human Services that the hospitals reported.
But not necessarily COVID deaths, right, Bob?
I would hope it would be COVID deaths, but I'm not sure about that.
I was just curious because I saw one from Marquette. Thank you. This is good information. And I think we've received this data, the last couple of weeks, one of these, but to kind of hear the breakdown and some of the context around what's going on is very helpful. Do you have any other things you wanted to show us, Jerry, before we open it up to questions? I think you had mentioned the dashboard.
Yeah, there's one. Well, I want to show you that, but there's one. We get regional data, and I just thought this would be interesting to share. So this is regional data for, actually, that's the wrong one. For the entire Upper Peninsula. Okay, so this is. Let me see if I can expand this. It's probably pretty.
I was just going to ask if you could maybe zoom in a little.
Yep. Hold on. Let's see.
Perfect.
Okay. So this is the entire Upper Peninsula. This is Region 8, and you can see that there's 13. This is actually as of the 25th. This only gets updated once a week by the regional epidemiologist Scott Schreiber, and 13,099 cases in the UP confirmed cases. And what he did is he drew the under 18. So this is basically the pediatric population. And of the 13,000, 1,200, so just a little under 10% of the cases are pediatrics. And then he does give a breakdown here of the cases. So 0 to 95 cases. And really what's interesting is kind of the percentages. So I know that the governor, Health and Human Services, made a comment about when they closed it, they said the high schools are where, let me see if I get this straight, 50% of the outbreaks and 67% of the cases are in the high schools. But we don't quite follow that here in the UP, but you can see that the high school and the middle school combined make up quite a few of the cases. I thought this was, pretty interesting data, but this has to be pulled from our epidemiologists, or we actually have to go mine the data ourselves and try to get that out of there because it's buried in the system. So, and I guess the last thing I will do is just take you to the website, if I get this right.
Thank you, Jerry. Very interesting.
Okay, so this is Mask Up Marquette. The site is available. It's just MASKUPMQT. And just want to pull you down to the bottom here. And these are the individuals or the agencies that were responsible for putting this website together. QPAD, the Health Department, Marquette County Planning Department, and then the Community Foundation and Flagstar Foundation. You go on to the data and it just takes a minute to load. Okay, and I guess the nice part about this, and these are basically the same slides I showed you, but I just couldn't print these off of the website. But the nice part about this is you can hover, and it gives you the information on whatever point you're at, averages, and right on down the line. So it's really kind of a nice website. So you hover here, we're at 2536 as of 11/29. I think this site has all the basic information that's needed by the people making the decisions. And like I said early on in my presentation, I don't know really the point about it saying all the national datas, but I can tell you the Dakotas, Minnesota, Iowa, Wisconsin, Nebraska, Montana, the upper Midwest, and the plains upper plains are really where the hot spots are in the United States. And I will pause. I know we can ask questions, but also if we want to ask questions now, but Dr. Lorenzer did put together just a quick summary of questions that people might have on vaccines. So we can ask me questions or both or refer to that. It doesn't matter.
Commissioners, any important questions for right now? Commissioner Davis?
Yes, the information on the hospital capacity is pretty alarming. And if you haven't worked in the healthcare system, 78% of occupancy at the hospital sounds like there's a lot of room. But perhaps Dr. Lorenzer could talk about what might be a normal occupancy rate. And also, there's only 2 ICU beds today available at Marquette General, and yet we're the regional medical center. So as soon as Houghton, who's 100% capacity at ICU, needs an ICU bed, they'll send them here. And what kind of surge plans are in place for once our ICU beds are at 100% capacity? And not only, what kind of surge plan, but, how is the staffing level for all of that? So that's kind of a lot of questions in one, Dr. Lorenzer.
First, can I say that I will answer it, but you probably have to talk directly to the hospitals. I can't answer for the CEO of the hospitals, all the different hospitals. But I think people have followed my interview with TB6 and some of my other interviews. My most concerning feature for the general public is the overwhelming the medical care system. So when you end up talking about ICU beds, there's days like Jerry's these are daily reports. There are days that all the ICU beds are full, not just at Marquette, at most of the other hospitals. That concerns, I believe that would concern all the CEOs. It concerns the staff that you end up talking about. What do you end up doing when they're all full? The hospitals do have surge, capacities, et cetera. But the main thing is not probably the facilities or the equipment, it's the personnel. Who's going to take care of them in terms of nurses or doctors. And they're both very critical, or the supportive staff. In the past, you always heard about, like in New York, we're going to build field hospitals, we're going to do this. Right now, throughout the whole nation, there's staff that can't staff it. North Dakota can't. They could create a field hospital, but they have no one to staff them. To give you an idea, if anybody knows how much a nurse makes, a traveling a nurse for COVID can fetch anywhere up to $8,000 to $10,000 a week. If that tells you anything about the market, supply and demand, it's very concerning. So in terms of what would happen if there's no room at the inn, they try their best. The Calvary, and I think even the CEO of Marquette basically said, the Calvary is the vaccine. Until then, we could be in a whole bunch of hurt. There are problems referring people onward, what hospitals you go to. Wisconsin, their referral patterns are full. UP is getting sometimes phone calls from North Dakota, South Dakota, and Minnesota. Can you help us? We're asking other people to help us. So it's very concerning, and that's why you see you can't go on the news, right, without reading or hearing about healthcare, exceeding the critical level of healthcare. It could be very problematic. It could be.
And one thing I will add to that, Sally, is I know the CEOs, they talk once a week. They have at least one meeting. And up until, it started going, Marquette was taking all the patients. They took all the patients from every hospital. Now, as you can see, those COVID patients are being moved around. So they're trying to manage the COVID load, based on severity and stuff. I don't know, I'm not a CEO of that, but I think they're trying to distribute that, even though it is tight, to the best of their ability. And like Dr. Lauren just said, they're doing the best they can.
And please, the occupancy rates, don't even look at that, because that's very misleading. So you have 15 beds open in the neonatal intensive care. That's not where the COVID patients need to go. So if you're going to look at anything, look at the ICU capacity and occupancy, and look at adult general medical floors, and the statistics it doesn't hone in on that.
Other commissioners with any questions right now before we have the next portion here? Commissioner Stonehouse?
Yes, ma'am. Dr. Loringer and Gary, thank you very much for a wonderful briefing. It's extraordinarily insightful and certainly well worth the effort you put into being here tonight. One observation and one question, if I may. Observation being that looking at the age graph of people being impacted by COVID, it seems that the only real number we have that's a good number is the total number, because the results of testing a given age group are very dependent on the number of people that show up for a test. If we were testing everybody evenly across, it might give us a whole different perspective of impacts within groups. So again, I guess I need to think about the end game and not necessarily the bumps along that graph. The other item is that, is it possible to have a breakdown by municipality? As a commissioner in the city of Marquette, I'm intensely concerned with how the impact has been with the city. And I think that would be very useful for us as the political leaders of Marquette to be able to know where the emphasis points need to be. I'm not asking for anything beyond a gross number for the city, understanding that we have that data from Northern, we to a point can extrapolate it probably from the prison staff, But of the number that's been in Marquette County, the number that I see every day from TV6 and their graphic material, it would be wonderful to know how many of that number are in the city of Marquette and how many might be somewhere else. Though I have no interest in somewhere else as much as I do my voters, my constituents. Or am I too far off in the woods on that?
Well, so Commissioner Stonehouse, I can address that. And I did kind of a call to the regional epidemiologist, and it's right around 1,250 to date. Now, he doesn't have the breakdown. And again, he's the only one that really can do that on a regular basis, but I have to make a call. And he did share a graph, which he said he still has to polish up. But right now it's about 1,250. And what I will say is that, we're in an urban area, and, generally speaking, urban areas, it spreads more. So you would just typically see that, when it happened downstate, it was Detroit, Wayne County, Lansing, Grand Rapids. So, generally speaking, you're going to see the urban areas have a disproportionate share of that geographically throughout a county. But right now it's about 1,250.
Well, thank you very much for that insight. I expect a big number, obviously for all the logical reasons that you tell us. In fact, the county recently did a survey of the number of people that commute into Marquette every day to work, and it's about 10,500. And about 3,500 people from Marquette going out to work in other places. So we know there's vast movement of people around, but it's very nice to have that in perspective. Thank you.
And keep in mind, the test results they go where the zip code is of the person that gets the test. So this came up when the prison happened. So the prison had X amount of correction officers tested and positive, but some of those people worked or lived in Baraga or Munising. So even though they said, here's 200 correction officers that got tested, they weren't all in our numbers. They got spread around because of their place of residency.
Right. Now, I understand that dichotomy, but again, thank you very much for your insight. It is appreciated. Thank you, Your Honor.
Problem. Commissioner Mayer?
Yeah, I'll try to be quick. And I think that was a great question as well, Commissioner Stonehouse. I was kind of a little curious about that too. One question that I'm kind of concerned about when I'm thinking here is what kind of surge are you guys just anticipating in the next week or two after Thanksgiving, the Black Friday, shopping holidays? Even if you could ballpark, just an estimate, if you have any kind of idea what you're thinking.
I think Commissioner Bonzell sort of asked that question as well. What would, if we could give a COVID, presentation after COVID restrictions 2 weeks? It is really hard to tell. I can tell you that restrictions generally are effective, and as you can see, other towns, other cities, other states, other countries have done that as well. I don't know if I'm going to be able to make a prediction. That's a crystal ball I don't have unless Dr. Lorenger wants to take a stab at that one.
Yeah. Well, let me put in a couple other stabs. Other people are making stabs for us nationally, and we're no different than the rest of the nation. So if you look at Fauci's stabs at it, you look at the coronavirus, task force, they're very concerned. They actually think things are going to be a very bleak 4 to 6 weeks. With that being said, again, what are the predictions? The national level, 4 to 6 weeks. It could actually go up another 25 to 50%. Will it? Time will end up telling. Now, when you end up doing, just give you some idea over here, a total shutdown, maybe back what you guys experienced in April and stuff, a total shutdown probably decreases coronavirus spread 50 to 75%. So when people are asking about, could we show you data, in a couple of weeks what the governor or, the HHS did, it all depends on people's behaviors. So if it goes up, will you consider if it goes up, did the governor's initiative not work? Well, we'll end up saying it could have went up higher. If it went down, do we give it credit? It all depends on people really quiet down. I think people are getting scared now. And reason why they're getting scared is because of the medical care data. You know, the medical care, when the ICUs are full, it's really scaring people. So what do I think? If you look at Europe, they probably actually said, we have another bad 2 or 3 weeks in front of us. So you got Thanksgiving, we'll feel the effects of Thanksgiving 10 days afterwards. You have to wait about anywhere from 1 to 2 weeks. So 10 days after Thanksgiving, we should have an idea what Thanksgiving did to us. Well, then we're going to hit Christmas. Then we're going to hit New Year's. So it depends on people's behavior. It's really the behavior. So I will not give credit to almost anybody besides you and us, what our behavior will end up doing from over the next 4 to 6 weeks.
Thank you. Appreciate it.
I'm looking around. Any other commissioners at this point? We will have a chance after both presentations are completed with any additional questions or comments as well. Okay, I think Dr. Lorenzer, welcome in your new role. Congratulations. We're glad to have you. And it looks like you've got some vaccine data to share with us.
Yeah, I could also answer any other questions, but I got some stuff about vaccine. As long as people understand, my concern is, the availability of medical care, which we already talked about. Long-term care facilities is where all the deaths are coming from, and we could do anything about that. We're really focusing on that. Schools are a hot topic, and that's another whole presentation in the vaccines. So if you want to update in the vaccines, I could answer really almost anything you can, but I'll give you the update as about 5 o'clock today. The vaccines will still have to go to the FDA, right? They'll go to the FDA. Pfizer's will probably be voted on December 10th. Moderna's vaccine will probably be December 17th. I'm saying probable because they could actually speed it up or it may take longer. There's still a possibility both vaccines may be reviewed by the FDA on the 10th. Once they give their vote as a positive vote, then it will go to the CDC's committee, CDC Advisory Committee on Immunization Practices. They're quite important. They will tell us meaning medical providers throughout the whole nation, which vaccine we could use on who, what are the guidelines, who should get it, who should not give it, what vaccines we could use, et cetera. They'll define all of that information. Currently, they haven't been able to do that because they haven't even seen the data that's coming from the FDA. So and they will meet within 24 to 48 hours after the FDA votes on each vaccine. So we always talk about Pfizer vaccine and Moderna. AstraZeneca is going to be right behind them. And there's probably 6 other vaccines that I believe would probably be approved in the United States by probably spring of 2021. Now with the vaccines itself, what they're trying to do, what a big important area for the ACIP is addressing tomorrow is because there's going to be a shortage of the vaccine initially. So they're going to have to allocate the vaccine to the highest risk groups. So they follow ethical principles and I got a handout for this if people want it, but the ACIP will follow ethical principles of maximizing the benefits and minimizing the harms, mitigating health inequalities, justice and transparencies, and they've been very good at this. They will be voting tomorrow on the categories, I believe, if they finalize their vote, which will be quite important with this, the national planning, including Michigan. They call it phase, they put them in phases, phase 1, 2, 3, and 4. We're looking at phase 1A. Phase 1A, the jumpstart phase. Phase 1A is healthcare personnel and long-term care residents. Those are the nursing home people. Those are the people that are dying. The healthcare personnel is paid, we're on paid, EMS, first responders, nurses, doctors, pharmacists, labs, etc. It is thought that the initial allocation of vaccine will probably only cover 25% of the phase 1A. So there'll have to be probably addition allocations. Which doctor gets it? Which nurse gets it? And we're waiting for the CDC to give us guidance on that. The UP's guidance, along with the state's guidance, are probably ERs, EMS, hospitals, ICU, nurses, and long-term care facilities again. They'll be probably at the highest of the high of the healthcare personnel. Then once there's thought to be 20 million healthcare personnel. There's a lot of people in that category. Then it will be followed by phase 1B, essential workers. Those are your teachers, food, agriculture, grocery store people, police, firefighters, snowplow people, etc. 1C will be adults with high-risk medical problems and adults over the age 65. When you look at those 1A, B, and C categories, that's probably 150 million people. The general public, whoever I'm looking at over here, if you're young and healthy, you probably won't get your vaccine April, May, June, July. Depends on what vaccines are approved and how fast they can manufacture them. The United States has pre-purchased 1.2 billion doses of vaccines. Well, that's a lot of people. We probably have enough vaccines pre-purchased for 5 vaccines per person. Well, they did that on purpose because they don't know which vaccine is going to win. So they put, give 100, give billions here, billions there. The number one country, I believe, in the world for pre-purchasing vaccine is our northern partners, Canada. I think they got a lot of vaccines. So what we're looking at is thought that Pfizer and Moderna will have enough doses probably for up to 20 million people by the end of the year. So we're looking at allocations, sub-allocating, etc. The CDC is doing their job, then Michigan will get that, then the UP will get that, then Marquette will get that. So we're prepared, we're ready to listen, we're ready to hear what the CDC will decide, then we'll move forward. This is your Calvary. The vaccines look very exciting. They look extremely safe, but the data hasn't been analyzed by all the experts. We only hear little blurbs here and there. So, and AstraZeneca is getting a bad rap. Their vaccine may just be as good as the other 2 vaccines. But you have to get into the data, and very few of us can get into it. So that's kind of the general view of the vaccine.
We certainly appreciate that update, Dr. Lorenzer. It's nice to hear of something hopeful to look forward to with COVID. It's been quite a while since we've had anything to look forward to in the COVID realm. So thank you for explaining how the process works, and I'm sure it'll be interesting to see how that all plays out here locally, when we do start to have those vaccines roll in. Commissioners, other questions or comments for either Dr. Lorenzer or Jerry Messana, Mayor Pro Tem House?
Yes, thank you again. With the vaccine, since it is a 2-dose, 3-week interval, before you've gotten both vaccines, are you not, obviously you're not protected, and will that continue to impact our medical staff availability? What do you see for that? Do you have to go into quarantine or something when you're halfway through? How does that work?
Yeah. Data hasn't been published, and they will probably advertise exactly your question. So if you're asking me and my friends where I get my data from, which is, almost all vaccines are probably efficacious even after the first dose. The 2 doses are given. Remember, there are some vaccines like the Johnson vaccine is a 1-dose vaccine. So there are 2-dose vaccines, 1-dose vaccines. It is thought that probably after the first dose, you might have about 25% protection. So that's why, initially. So until you get both vaccine doses, you're still going to be considered at risk. Even after getting both vaccine doses, the question is, does it prevent infectivity? What the data is showing, remember, this is not published stuff yet, so I could, we'll see if this is true or not. The data that's coming out is it prevents serious illnesses. It's preventing deaths. It's preventing serious illnesses. There is no publications or even data leaks out there that it prevents infectivity. That means you could get the vaccine and you can still be infected by the virus, but your immune system is conquering it. You could still be infectious to other people. So you will still see, I got the vaccine. Do I need to wear a mask? Yep. That data about the infectivity will probably be known. My guess is probably summer, maybe the earliest summer, because they have to follow it down the line. They have to have enough people and follow the infectivity out. So that's probably, but we'll see. I mean, you know, when the data is analyzed, we'll be hearing a lot more about this.
Yeah, thank you. So it's not like we're just done when the vaccines come. I mean, it's going to help, but when you said to know that we're still going to have the thing about this virus is that you don't even know you're infecting someone, right? That's the terrible thing. We can't see it in any way, and so that's what just is confounding us. It seems like.
Yeah, you remember when we end up looking at if there's 315 million people, vaccinating 20 million people initially for probably the month of January and February is to allow you to get medical care. I mean, see how that one goes? Will it affect anybody's behavior that's on this phone call? The first whole allocation of the vaccine is to allow you to have healthcare providers in your hospitals taking care of you if you get sick. It's not going to change anything else for anybody else. Taking 20 million people out of 315 is not going to change that little virus running around infecting people. Until you get that, remember what we call the herd immunity. Until you get a herd immunity around 70% is where you'll start seeing the transmissions really going down. So that's why Fauci's and other people are saying, you know, it's going to be months, folks. But I think it's really important, you know, for me, that your ICU doctor and your nurses are available for you if they are not getting sick. I mean, look at, you know, Mayo Clinic, you know, had 1,000 people sick at Mayo Clinic. They were calling in retired doctors and nurses. You know, the UP is not that far away from that, folks.
Can I ask?
Oh, sorry, go ahead. Go ahead.
I have one other question and then I'll stop. With that, thank you. Yeah, the question was, so when you say there's 1,250 cases in the city of Marquette, how many total cases are there in the county? Like, that's hard, you know, you need a denominator to understand what that number means. It's not against, I mean, you can say 1,250 out of the 22,000 residents, but what else, out of the number of cases we've had total in the county, what does 1,250 represent?
Well, in the total county is 2,536. So I showed that on the slide. That's on the Mascot Marquette graph. So it's 20. So roughly a little less than half of the total cases are in Marquette County.
The city of Marquette cases are roughly half of county.
Correct.
Yeah. And if you look at the statistics, again, please be careful of how we all analyze statistics. Let's just say the UP, the cases in the UP are about 4%. It means, you know, the cases that we identified, about 4% of everybody in the UP has had COVID. Well, we call it an ascertainment bias. It's thought by the CDC that underestimates the real cases by 8-fold. So it could be anywhere from 20 to 30% of the population has already been infected with COVID. So this ascertainment bias is a big issue. Those are the people that, you remember, 30% of the people probably never get sick, 20% of the people transmit it, then get sick, and the other people are sick. So there's a lot of people out there that have already had the illness or have already been infected, but they haven't had anything wrong with them. But 30% is a long ways to go to herd immunity to 70%. That's our vaccine. That's our Calvary.
Wow. Okay.
Thank you.
Commissioner Bonzo?
Thank you, Madam Mayor, and thank you for that information, Dr. Lawrence. I'm just curious if you have any sense right now, and I understand if you don't, I'm curious if you have any sense what role, if any, the city of Marquette might need to play in vaccine distribution, education, anything along those lines. How do you envision us being able to help you once the vaccine becomes available?
Mm-hmm. Could I say, I think, you know, Jerry will pump in over here too, but the 1A category, which is all, you know, the 1A, the healthcare providers and the long-term care residents, we probably don't need any help from anybody. I mean, because this will be the healthcare providers shooting up themselves, right? if we're allocating amount, so Marquette say, the UPHS Marquette may say, here's your 500 doses. I do not see a need for volunteers or public health nurses to go help, hospitals give their own vaccines or their own healthcare. It will change greatly in the 1B area. When you go to the essential workers, right, and just adults with high-risk medical conditions, I would believe, and I think we're having a tabletop on Wednesday with our staff in the state. This is where I see all hands on deck. The public health nurses, are not going to be able to do this. And if we tell our staff to go do this, they can't do their essential stuff on other COVID activities. So when we get to phase 1B, all hands on deck. We're going to need all private, people, the hospitals, the pharmacies, the public health. We probably should have maybe mobile clinics, drive-in centers, permanent places, everybody. And Jerry, along with the other health officers, are working on all the details of that. My guess is the 1B will probably start maybe late January. And we're having a tabletop on Wednesday afternoon discussing exactly that.
Yeah, thank you so much for that. And I mean, I think I probably speak for everybody on the commission when I say that, I think it's really important that the city of Marquette does everything that we need to do and everything that we can do to help with that process. And so please do keep us apprised, because I think it's incredibly important.
Jerry, do you have anything to add on that? Or?
Well, no, absolutely. I mean, right now, probably, facilities as well, and volunteers, because we really don't have the facilities to do that either. And we also, would like to expand testing here, and we have some opportunities in the near future to do that. So that is also going to require some local resources that we don't have here at the health department. So as we learn more about this, we certainly will communicate. And, as a public health official, I'd like to promote and have the city help promote the fact that the vaccine is important. And I think some people might feel differently about it, but I think, that would be a very helpful communication as for us to promote it, more than anything.
Absolutely. Thank you, Jerry. I really appreciate that.
Other commissioners, questions or comments?
Mayor, I have two quick things if there's no more comments.
Sure, go ahead, Jerry.
We are, in order to try to mitigate, because I think you saw a press release go out a couple weeks ago about our prioritization of doing contact tracing and case investigation. We are piloting a new way to contact people, the ones that aren't like critical. We're using what's called the MyHON. It's the Michigan Health Information Network, and connecting that with our MDSS database. So we're going to be able to, if all things work right, do a data dump from our MDSS system into the MyHON, and it will robocall people. And so we're going to have a press release go out in the morning. Right now, we simply can't keep up, but this will at least be a way to say, hey, you been detected, you're positive, please contact your provider, please isolate yourself. It'll have like some canned information just to simply catch some of those people that we might not be able to call in the first round, because we're at best getting to maybe 20% of the people on the first round within 24 hours. So this is going to go out tomorrow. And the other thing I would like to remind everybody to get your flu shot, because we have seen some local co-infections of people with flu and testing positive with COVID-19. So I think that's going to complicate our challenges that we have in the near future. So I would encourage everybody to get their flu shot.
Thank you, Jerry. Good updates. I jotted some of those down. That's I know you all are doing everything you can, and you have been since March, April. It's an incredible task that you've been managing for 9 months now, and I certainly appreciate everything that you've done, Jerry. Looking forward to seeing how Dr. Lorenzer fits in, and I know he's got a little bit of a bigger role as he's providing services for multiple health departments, which I think, you know, will be a good thing for our local community too, to be connected in with that. I know we're all working together here. Certainly appreciate everything you've done and continue to do, and you're doing a lot of great things for our community, so thank you both. Anything else from the rest of the commission? Well, thank you both for joining us this evening. I appreciate the presentation, and hopefully we're able to kind of get through these holidays and see things either stay the same or improve, and we'll have a vaccine around the corner, so hang on, folks. You know, we're in this together. Thank you both. We'll talk with you soon. I'm sure we'll be getting updates as time goes on.
Thank you for your support as well. Thank you.
Thanks. Okay.
Thank you. All right. We have one more presentation this evening. We have Matt Kurta with Kurob and Associates, our lobbyist, and I think he is on this call here. Hi, Matt. Thank you for joining us.
Thank you, Mayor. Good to see everybody. Thanks for having me on.
Yeah, go ahead whenever you're ready with the presentation, and then after your presentation, we'll open it up to the commission for questions or comments.
Sounds good. I'll just share the screen here and get back to the start.
Perfect.
Well, wonderful. Thanks for having me on. And once again, I wish I could be home and in person. Be the first year of my life I haven't made it back home to the UP, but extenuating circumstances. So as we just heard, so we're all hanging in there. Put together a few slides here just to kind of guide some of the latest things that we've been keeping an eye on, things that I've been informing Mike on regularly, what projects we are working on. So once again, it's good to see familiar faces, and for the 2 new commissioners I haven't yet had the opportunity to meet in person. I look forward to getting up to meet you in person eventually. I think I'm just going to jump into the first slide here. I guess just to start off first, can everybody hear me okay and see all the slides?
I think so. I'm able to hear you and see the slides. I'm looking for head nods, and I'm seeing them. Perfect. Yep, go ahead, Matt. Thank you.
Wonderful. So obviously, you know, we want to start out with what happened on Election Day and how that affects all of us and the work that that we're doing down here in Lansing and back home as well. Really, after everything that happened in the State House, all the millions and millions of dollars in mail that filled up your mailboxes, the State House Senate will continue to be 58 Republican, 52 Democratic. All that effort for 2 open seats flipped to the Democrats, and the Democrats were able to defeat 2 incumbent, the Republicans were able to defeat 2 incumbent Democratic legislators. So for the 3rd cycle in a row, same margin in the State House. However, we're going to see a little bit of a changeover as far as leadership with the current speaker and current Democratic leader leaving office. So I put the names of the 2 new leaders up there on the screen. Jason Wentworth from Farwell, central part of the state, Claire, who's been in the House for a few terms, as well as the new Democratic leader, Donna Lisinski from down in Scioto Township. That's out County, Washtenaw, for those of you who aren't familiar with the 2 areas there. So 2 legislators seasoned in their 3rd term. I also put a note here too, the Senate's going to be interesting, and this will have a cascading effect. We're going to have a couple vacancies in the Senate come the 1st of the year with a couple legislators who've been elected to local offices. That won't change a lot with respect to how things work in town, still controlled by the Republican Party, but there will be a couple vacancies to fill. That will kind of set up next year to be very interesting, though. We've kind of calling a cascading effect, whereas open seats are open in the Senate. The governor will call special elections. We'll have to figure out the timing of those. You probably have some members from the House run for those elections. That will then potentially open up some seats in the House that will be vacant if those legislators were to win. Then you call special elections in the House, and all of this in the backdrop of less than 2 years from now, we're going to have all new districts for everybody. So it's going to be a chaotic 2 years, and really spring of 2022, every district is redrawn as we have an independent Citizens Redistricting Commission. Does that affect a lot back home? You can only draw lines so far. You can't annex Wisconsin. You have to go the other way. We'll see what happens as far as population lines and where districts are redrawn. But it's going to be an absolutely fascinating thing we've never seen in the state with legislators assuming no further court challenges, not having any control of redistricting, and that affects, you know, all the work that we all follow. I also put a note there at the bottom, 24 new House members taking office in January. We're going to have a number of new committee chairs. Some of those have been announced, and many of those have not yet been announced. This is a smaller class than usual, so we have a little bit of experience, a little more than we usually have carrying on. But once again, that's 24 people who will have to get up to speed, kind of starting from scratch for the most part. And we'll find out a little more with committee chairs as those are announced. And we can talk more about how those affect the city in particular. Talking about COVID, this was talked about by the health department in detail a little early on. I just put a few bullet points here. We're mostly aware of all of these. I'm not going to venture a guess on what happens on December 9th once the December 8th order is up. It was a 3-week order that can be extended. However, we're kind of heading into an unknown period of state law here where we've really not had, we've never had the 1976 law the governor utilized, extended month over month. That obviously was challenged in court. We now no longer have a 1945 law. It remains to be seen now, are we going to further challenges to the 1918 law? We've seen a few preliminary challenges from some official businesses downstate. At some point, those will wind their ways through the courts, but it's going to be a while. So I think it's fair to assume we're going to see, we probably don't see a full elimination of everything on December 9th, but we just don't know yet. We'll know a little bit more about that next weekend. And I put a note here at the bottom as well. The guidance continues to change regularly. Mike sends a lot of questions my way. Feel free to send questions. If you're confused by certain guidance, you're hearing things that conflict. Policymakers are doing the best they can. You hear over and over, there's no manual for this. They're trying to figure out what they can do. Sometimes week by week, day by day, they're trying to figure it out. We try to reach out to get some interpretation, as it can be incredibly confusing, especially on a few topics that we'll talk about here on the next slide. So ask away, feel free to ask with questions. It's very confusing times for folks down here as well. I don't want to spend a ton of time on COVID as you've had that discussed in great detail already by the health department. So legislative update. I put a couple highlights on here, and I have another slide after this as far as some particular issues. Lame duck this year looks a little bit probably shorter in duration. We're not sure about shorter in volume. It's been a challenge for both chambers to continue to meet regularly. The legislature and Lansing are not immune to COVID infections, and there have been challenges in following health guidelines for legislative meetings and session meetings. The amount of days have been scaled down significantly. This week, for example, we have a day or two of session in each chamber, and then committees on days when the chambers are not meeting. So probably a little bit shorter than usual, but I'll believe it when I see it. Lame duck is always long and excruciatingly painful. Things appear out of nowhere. However, this is the first time we've had a bipartisan lame duck in 8 years. So it's safe to say that there probably will be some things that are slowed down a little more than usual. I wanted to talk about short-term rentals in particular. We talk about this a lot. We've made some progress as far as the various bills that are in play. There's 5 different bills currently in the legislature in both chambers that get at the short-term rental issue in a number of factors. There's a House package that kind of is very local government, MML friendly, that MML's been working on. You have some bills that are a little more, I would say, friendly to the short-term rental world and the ability for owners to have a little more leeway with how to manage properties. You also have some bills that in the Senate in particular that look at coming at this in a different angle entirely of allowing new assessments to be created that fund not only Pure Michigan, but also return money to local units of government. And you also have, in between these bills, you have the existing lodging industry, which is obviously concerned with how this plays into existing assessments, the CVB assessments, the UPTRA assessment, other taxes on local assessments. I think that we've made some progress in sharing the story of kind of how your ordinance is working well. We've been providing a lot of updates, trying to serve as mediators between multiple parties here. On the one hand, trying to stop things from moving along rapidly that are very troublesome, such as the first bill introduced last year that would have completely preempted local zoning. I think there is an interest in finding a compromise here, and I think that we're going to see some discussions here over the next couple of weeks. I don't think that we're going to see anything wrapped up or finalized this year. There's a chance, there's a shot. I think the concept that's been introduced in the Senate in particular of allowing you to, as a local unit of government, to keep some of the revenue raised from new assessment, maybe some kind of cooperative deal with Pure Michigan, maybe locally, maybe regionally. That concept has started to gain some steam. I think there's also some room in the middle here, as long as we don't have a complete preemption of local zoning, and as long as we don't have a local ability to completely disallow all short-term rentals, there's room to meet in the middle. And your ordinance really has shared it with a lot of folks around the state. It's helped to show how if communities want to find a way to work with their local realtors and their local hotel and motel lodging folks to find reasonable regulations, it's possible. Oftentimes negotiations start where both sides start at the end of what they want, and then you need to force those folks to work backwards. So we've made a little progress there. We'll see if a deal comes together. I think you'll see a lot more discussion on this in the next few weeks, and then probably next session kicks off with some more serious negotiations, unless there is some grand bargain achieved here before lame duck ends. I could stop there with questions, or Mayor, I can keep on going through all the slides. If anyone wants to jump in with questions, maybe raise your hand or give me the sign to stop and I can take a breath. So please feel free.
Thank you, Matt. I appreciate it. I'd like to try to get through the presentation and then ask questions unless someone has a truly critical thing that they need to ask. Just want to make sure that we're able to kind of get through the material. All right, go ahead, Matt. Thank you.
Sure thing. Open Meetings Act, actually a little bit of news on this tonight. Actually, I had a call from one of the sponsors of the bills right before I jumped on here. 6207, it's a House bill that deals with the Open Meetings Act, sponsored by Luke Meerman from the west side of the state. There's going to be an attempt here, which I think probably is a good shot of happening, to extend virtual meeting flexibility. Currently, that's allowed only through the end of the year, and then that meeting flexibility scales back as we get into January 1st next year. There would be provisions. Basically, right now you can have open meetings for no reason through, virtual meetings through December 31st. Current law says starting in January that will scale back to only people with medical conditions, active military duty, or declared state of disasters, state of emergencies. That third point, the language is not really that tight and needs some revisions. A lot of this was worked on in October. The deal they achieved then was the best deal they could get. Some folks wanted to go further, allowing more flexibility, allowing a number of other concepts, including the ones I mentioned. Some folks did not want to go as far as allowing any virtual meetings. So, such as the give and take of legislative compromise. As of now, I think there's a good chance the bill comes out of the House this week that would allow no reason virtual meetings until March 31st. But also would tighten up the local declaration ability, where it would be specific to say if a local chief administrative officer, in this case being the mayor, if the mayor chooses to declare a local state of emergency, state of disaster, it could be the county administrator, something like that, then you would also have ability for fully virtual meetings. They would have that disaster threshold. So I think that would provide a little more flexibility for local governments to meet. However, in order for that to happen, there will be additional provisions, ensuring the public has access to meetings, ensuring the public has the ability to interact in a number of other, what I would call belts and suspenders approaches to making sure that the spirit of the Open Meetings Act is not being violated. And the two-way communication is enabled to the greatest extent possible until we get into better times, hopefully next year. So we'll probably see some movement on that this week. We'll see how that deal comes together in the Senate side. I don't know if there's going to be an ability to get more language than that. There were some things that were taken out of the Open Meetings Act in October as well that had existed for years that were tightened up. We'll have to see how that work goes in the Senate. The fourth point I want to touch on here, budget outlook. This year went very well, especially compared to where economists started out. I remember we were hearing discussion in the spring of a $3 billion shortfall this year, a $3 billion shortfall next year. The state did have to enact some cuts for the recently concluded state fiscal year. However, thankfully, the economists largely got it wrong and underestimated the impact of unprecedented federal stimulus that we've never seen before. And that stimulus worked. You know, the feds did everything they could to keep the economy afloat. The challenge is you can't do that forever. Eventually, you know, the bills come due. We saw robust sales tax from the stimulus. We saw record consumer spending. The online Wayfair sales tax decision that many people may have forgotten about, that the legislature enacted mandating online sales tax, that really saved us this year. Think back to the spring with tax collections. You weren't going to get a haircut. However, you know, we had Amazon boxes appearing on your door every other day, now subject to sales tax. So that helped out. The challenge there is the state was able to use all this one-time money that was unexpected. In August, we ended up being $2.5 billion better to the good than we thought we were going to be for the recent concluded fiscal year. The state was able to carry that forward. The challenge is that was one-time money. And now it remains to be seen, are we going to see additional federal stimulus? We're growing, the economy's doing all right, better than expected. But the challenge is now our baseline has been reset, what we need to grow out of. So to this point, revenues are doing okay. We're actually doing better than expected, but we are still facing dark clouds on the horizon with respect to the state budget. The state budget stabilization fund still has a healthy balance. We'll just have to see what happens. But fiscal year 23, the governor mentioned the other day, is looking at $1 billion hole with current spending levels. So how that affects revenue sharing remains to be seen. The good thing with revenue sharing, however, is sales tax growth continues to be robust. And let's hope that that trend continues. So the current budget year, we don't foresee any major challenges, but the state budget year starting next year in October is going to be challenging, absent again any additional federal one-time stimulus. A couple opportunities and local issues I wanted to talk about to kind of personalize, and please let me know if you want me to go a little quicker or slow down. The first item there, Eagle has some opportunities, EV charging opportunities, EV charging stations, working with a company by the name of Next Energy as well. We did facilitate a call with Next Energy and some city staff. There's a note here, I have the link as well to the Catalyst Communities program at Eagle. I think this would be, given the size of the city and the makeup and the demographics and the culture of the city, this could be an opportunity. The state is looking for regional leaders to take up these opportunities, you know, maybe leveraging federal grants, leveraging private sector money, working with utilities, finding unique opportunities to do things. I wouldn't necessarily put it fully in the category of climate change. It was included in the governor's climate action plan. However, if you think creatively, there's a lot of ways to find opportunities here and for the city really to be a leader nationally. So I've shared a lot of that with the city manager as well. I think there's some opportunities to pursue here if the city would like to go down this path. The state's looking to find places to show off and to you know, engage in some of these interesting energy and climate issues. So more than happy to bird dog that a little bit more. I just wanted to put that on there as potential opportunities. Brownfields, the city manager and I talked the other day about the UP State Bank redevelopment. I know there's a disagreement with MEDC there. He's pulling together some local folks who are going to facilitate some discussions with our legislative representatives and see if there's a willingness to revisit that or see if we want to dig in a little bit further to the project. Again, open to feedback. If there's any ways that we could help, more than happy to help where we can. And also the Aerospace Manufacturers Association, the space launch coordination issue. There was the announcement in Marquette Township, as well as the Sioux looking for the launch control site. Just there's so many issues that, you know, I always monitor, not only being Marquette specific, but that affect the region and affect the you know, the ability of the city to act as a leader for the region. Not always things that have full, you know, 100% agreement on in the public, but things that I think are important to keep an eye on as far as working with other groups to really advance things across the Upper Peninsula that affect everyone. So those are 4 specific issues. I wanted to put a slide in here too, because I think it's a fair question to ask. I know that some commissioners ask regularly. I'm going to do a little more regular updating to the commission going forward. I'd like to do some monthly updates. I'd love to hear what you feel is valuable what you'd like to hear, frankly, what you don't want to hear, if there's individual things to pursue or not pursue. Please let me know. I want this to be valuable and productive for the city, and to ensure that, for the tax dollars you're spending, you're seeing the value for the help that you're hiring down here. And I always put a couple bullet points down here as well. Every month is different. This year has been a bizarre year where we had no legislative session for months. We all transitioned to figuring out how to work via Zoom, how to interact with legislators and state policymakers via Zoom. State policymakers won't be back to their offices until April at the earliest. I think it'll be even later than that. So timelines change, schedules change. It's an odd business at times to quantify. I always remark, if you build a building, you can point to the building when it's done and you say you built the building. It's often difficult in this line of work. I always try to provide, advice and talk to the city manager about any concerns that you have, interpretations of state orders, initiatives to pursue. But please don't hesitate. If there's things that you'd like me to be working on, if we want to look in the policy arena like we do with short-term rentals, if we want to look in the appropriations world, anything and everything is always, there's always opportunities down here. It's the way the world works. It's not always the way you'd like the world to work, but I think especially in a world where you have new legislators coming in the door and you have split control of the governor's office and the legislature, there's always opportunities that come forward. And you've heard me say it before, and I'll say it again. It's great to work for a city back home in the UP. I love the work that you guys are doing up there, and appreciate the opportunity to be of service, keeping an eye out on things down here. So I'll stop there, take a breath, and fire away if you have any questions.
Thank you, Matt. Nice job in the presentation. Appreciate the range of topics that you just covered. Commissioners, questions or comments for our lobbyist? Commissioner Bonzo?
Thank you, Madam Mayor. Thank you very much, Matt, for your presentation. It was really informative. I had one comment and then one suggestion, I guess. So first, I just want to thank you for the work that you're doing with regards to the short-term rental legislation. I think it's critically important that we retain our local autonomy and our ability to regulate short-term rentals. I think if there's any significant preemption, it would lead to further exacerbation of the concerning trends we're already seeing with regards to housing affordability in the city of Marquette, and I'm sure a lot of other tourist communities like Marquette. And then the other thing, I guess a question or sort of a suggestion is, I think that we all have certain areas of expertise, certain things that we're knowledgeable about. I'm very interested in housing policy, for example, whereas, I know that, Commissioner Davis has like a background working in healthcare, and, Mayor Pro Tem Hill knows a lot about climate change and environmental issues. And so I think that, I thought it was really great to see our city clerk, Kyle Whitney, provide some testimony to the state legislature about the elections. And I think, it would be interesting to see how we might be able to actually engage individual commissioners, if they're willing or interested in advocacy efforts for legislation that would help the city of Marquette. I think that would be, maybe something that we could take advantage of in the future.
Thank you, Commissioner Bonzo. Other questions or comments from other commissioners? Commissioner Stonehouse?
Yeah, Matt, let me echo Commissioner Bonzo's concern with the short-term rental situation and problem. I think it would be devastating for the city of Marquette to have that ripped up and to have it go away, because we have worked too hard and too long to make it work for everybody. So I would request that we all look at that as being an absolute priority for the city of Marquette, is to retain that, at least in the base form of it. Though I understand, obviously, you give a little bit, you get a little bit, but to lose that would be a devastating slap in the teeth to not only the city commissions that have worked on it and city staff, but to our citizens and everybody, I think, that's involved with Marquette in any fashion. So thank you for your efforts on that behalf.
I think it's a great question, and I think part of the challenge will be, because this is somewhat of a complex area with a number of complex groups, part of the challenge is, can we find a result where we're allowed to essentially kind of do the work that we do now under the ordinance you develop, but is that ordinance going to look different based on other ways we have to get at that? You know, there's creative things to do. Yeah, I just have a number of notes: creative things to do with zoning, creative things to do with saturation caps, creative things to do with returns of money and excise taxes. What could happen there? Are there funding opportunities? The legislature is kind of throwing all the concepts together in a pot and they're cooking, and we're waiting to see what it's going to look like. But I think, yeah, you know, outright preemption is of what you have is we can't let that happen. What we end up with, you know, it's interesting what comes out of the mix. But as I've said before, I think the fact that you're able to show you have something that's working, and as far as I'm aware, you know, local business folks are okay with the way it's working. Some people may agree or disagree with certain provisions. I'm hoping we land somewhere in the middle.
Matt, you know what the classic definition of an elephant is? It's a mouse designed by a committee. We don't have enough peanuts in Marquette to feed an elephant. We need to keep our mouse. But thank you for your efforts.
Commissioner Mayer?
Thank you. I don't want to repeat what Commissioner Stonehouse and Bonsible said, although I agree with both of them. Just kind of my general comment with this is, over the last few years, it seems like the state has more and more increased the way that they're restricting local governments the capabilities of governing ourselves. And it's just frustrating to me personally every time I hear more preemptions like this coming up, because it's, you know, there's a lot of things that the state could be working on instead of trying to tell us how to do our jobs. But completely agree with both of my colleagues just said, though. I just kind of want to throw that out there. The fact that anytime I hear more preemptions coming up like this from the state, it frustrates me personally.
I have to comment, but I'll try not to get in trouble. Local control is often used both ways whenever it's most convenient.
Mayor Pro Tem Hill?
Yeah, thank you. So I appreciate what Commissioner Bonsall said about us having different expertise and bringing us on board in appropriate ways, and what voices we could bring to the conversation. I think as this new group, as the seven of us figure out how we're going to be working together going forward, as you said, lame duck is full of surprises, and changes, you know, and the lack of consequences is part of the reason why it's called lame duck. And being clear that there's a difference between what goes on in the legislature and what goes on in the with the administration, and what leverage and influence we have with those two different areas, because those two branches are doing two different things. And right now, my understanding is preemption is all coming from the legislature, which is controlled by one party, and the administration's controlled by another. So just to be clear on where the preemptions are coming from. And I do think that there's, if we're gonna, as we develop an understanding of how we're going to be able to operate in the next 24 months of COVID, coming through this other side, I think that I want to maybe ask other commissioners, we're going to need to probably have to have some conversations together in some fashion, work sessions or during meetings, I don't know, but there's going to be some important issues coming at us, and what we do as commissioners and how we have that conversation. I think we're going to we'll be informed by, you know, what you can tell us about what's going on in Lansing, but we're also going to need to come up with our own priorities. Like, we know that where we stand on short-term rentals, on some of these other topics, we might need to have conversations among ourselves. So that's as much to everyone else as it is to you. But I think we need to, we're going to have to be maybe kind of nimble in thinking about how we deal with some of these things coming at us.
Other commissioners? I'm not seeing any. I'm making sure that I haven't overlooked anyone. I don't think I did. Okay, so Matt, you alluded to this, and I think other commissioners have as well. And, you know, the way that we've set up the relationship between our lobbyist, yourself, and our city manager is by design set up in a way so that each commissioner is not free to go to our lobbyist and ask you, you know, to help with a personal interest or that kind of a thing. And not that any of our commissioners have done that, but it's set up to kind of protect the commission, to protect the city of Marquette. But I think, you know, because things have been set up that way, it is easy for us to not see the things that you're working on, you know, a regular basis, other than maybe once a year or come budget time when we're looking at the cost and going, you know, well, what is the value here? So it sounds like you're willing and able to help us with that moving forward. And I appreciate your willingness to look at maybe doing some kind of a more regular update. And it doesn't need to be exhaustive or comprehensive, but just a little something so that we know, you know, you're engaged, you're paying attention, you know, you're you know, you care about the city of Marquette. That's what we'd like to see, because, you know, that's why we hire you, to see what you can do to you know, give us a hand down in Lansing. So looking forward to seeing what different ways we come up with and continue to evolve on that front, and appreciate what you've done for us so far. I know that there are many topics that you've helped us with, especially in the last year, and you'll continue to do so.
Sure, appreciate that. And yeah, we set things up where, you know, Mike and I communicate regularly, but you know, it's important that you're getting value and, you know, and what you're looking for down here. So happy to find ways to do whatever we need to do and keep things going well back home.
Great. Glad to hear it. Any other commissioners with anything quickly? I think we're wrapping up here, but if anyone had something else. Okay, well, I think we're all set. We appreciate you joining us tonight, Matt. I appreciate the conversation and the presentation, and look forward to hearing updates from you again soon.
Absolutely. Thank you very much. And everybody stay safe.
Thanks, Matt. All right, commissioners. We have been at our meeting for an hour and a half, and we're just now getting to the consent agenda. So here we go. Do we have a motion on consent? Commissioner Davis.
I move we accept the consent agenda as presented.
Okay, do we have a second? Commissioner Mayer?
Second.
And any discussion?
Not from me.
Okay. All in favor, please say yes. Yes.
Yes.
Yes.
All opposed, please say no. Motion passes 7-0. All right, we are moving on to new business. Marquette City Attorney appointment of Suzanne Larson. City Clerk, could you please read the background? I'm having a hard time. I'm looking for City Clerk Kyle Whitney down over there, but he's not there. He's on Zoom, wherever you are.
We can pretend. Thank you, Mayor. Real quick, I just wanted to say one thing. I should have said this at the beginning of the meeting. We talked about updates to the Open Meetings Act, and one of the updates is that under these virtual meetings, all of the seated commissioners need to indicate the county and city from which they are attending the meeting remotely. I'm going to assume that that's the city of Marquette and Marquette County for everybody. I'll put that in the minutes. But just moving forward, that's something that we need to do in these meetings.
Thank you. Kyle, I actually meant to bring that up, but I had forgotten, so I appreciate that. Should we probably have that as part of our roll call moving forward?
Yeah, I can incorporate that.
Perfect, thank you.
Moving on to item 6, background. On November 10th, Marquette City Attorney Ron Keefe notified the City Commission that he will be stepping down as City Attorney and that his final day in office will be December 31, 2020. He and his law partner, Suzanne Larson, have been providing legal services to the city for the last 15 years, and Ms. Larson and the rest of the attorneys at Kendricks, Bordeaux, Keefe, Savoy, and Larson PC remain committed to providing the same quality legal services the city is used to receiving from the law firm. Fiscal effect, none by this action. Recommendation, appoint Suzanne Larson as Marquette City Attorney effective January 1st, 2021. Alternatives as determined by the commission.
Thank you. Commissioners, do we have a motion? Mayor Pro Tem Hill?
I move that we appoint Suzanne Larson as the City of Marquette Attorney effective January 1, 2021.
And do we have a second? Commissioner Hanley?
I second that motion.
Mayor Pro Tem Hill, any discussion?
I am excited to have Suzanne step up into the role full-time and want to thank Ron Keefe for his years of service to the community and to the city, and many good wishes for you in your retirement. And thank you very much for your service.
And Commissioner Hanley?
I would like to reiterate everything Jen just said. I agree. I haven't got to work with you as very much, Ron, but I have seen a lot of your work and I think you've done a great job for the city. And Suzanne, I look forward to working with you moving forward.
Thank you.
Great. Any other commissioners? Commissioner Bonzo?
I'll be brief, but I really, I wish I didn't have to be, Ron, I think you've done a really great job. It's been a pleasure working with you. Wish you all the best. And Suzanne, I know we're going to be in very, very capable hands. So thank you for stepping up.
Other commissioners? Well, I know, Ron, we will have an opportunity later in December to truly honor the work that you've done here. So we won't get into that too much, although we are very sad to see you go. But we are also very glad that you have worked with Suzanne over the last several years and left us in a good position with a really great person to step up as city attorney. So we appreciate all that you've done over the past 15 plus years and the fact that you've really, made sure that we're set for the future. So thank you, Ron.
Thank you very much, Your Honor.
And I just had a couple other comments here. The City Commission really only hires and evaluates two positions, the city manager and the city attorney. All of the other positions at the city, public works, police, fire, city hall, they are all overseen by the city manager. So we really only have two employees that we oversee. So this is a very critical job that the City Commission is charged with. And I think that this decision, doesn't come up very often, and it does a lot to set the tone for the management and the oversight of the city moving forward. So I just wanted to kind of, say it out loud that this is really important work that we're doing tonight, and it feels good that we've got someone who's got a lot of experience, who is engaged in our local community, and who's really been working with the city of Marquette already in the background. So I guess, without further ado, I think we can go ahead and take a vote, but I think I myself, at least, I'm very excited that we've got a good fit here. All right, so all in favor, please say yes.
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 All opposed, please say no. Motion passes 7-0. Congratulations, Suzanne Larson. We're very glad to have you. I'm in trouble with there we go. All right, so moving on to item number 7, which Suzanne Larson actually helped draft for us, so thank you again. City Clerk, could you please read the background on our City Commission Rules of Procedure number 2003-01?
Thank you, Mayor. Each year, the Commission adopts rules of procedure to help the Commission run an efficient meeting and to deal with the public and the media in a positive manner. The attached version places the rules in outline format with suggested changes in red. Fiscal effect, none. Recommendation, discuss the City Commission Rules of Procedure 2003-01 as amended and approve the rules along with any changes the Commission should determine. Alternatives as determined by the Commission.
And commissioners, I know this is something that I think there are a few items we may want to discuss. I'm not sure if anyone wanted to suspend the rules for discussion. We could do that, or we could make a motion and then discuss. Fine, either way, just wanted to throw it out there. Commissioner Stonehouse?
Yes, Your Honor, I'd like to suspend the rules for discussion.
Perfect. And Commissioner Mayer?
I'll second that motion.
All right, all in favor, please say yes.
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 All opposed, please say no. Motion to suspend the rules passes 7-0. Thank you. And Commissioner Stonehouse, since you made the motion, I'll let you go ahead and start it off for us.
Well, thank you, Your Honor. I'm trying to run from a few different screens here, but I'm down to section 6, Roman numeral 6, and I'm looking at A, B, and C of electronic meetings. And what gives me concern is that section A, I think, is exactly what we're doing, and it's a great thing. We want to keep that. But I'm looking at B and C, which I have real questions about, because in the last 3 meetings that I've attended virtually with MML, this has been their #1 priority to fix in Lansing. In other words, to take the existing law that will run out in the end of the month, the end of December, and have that extended, or a variation of it extended for the foreseeable future, so we're able to continue to hold virtual meetings. According to MML, if we do not have that, if we cannot have that happen, then the end of December, we stop meeting virtually. And that was the word I had from them at the MML session this morning, announcing their new plan for Michigan's community stabilization, as well as a separate Monday morning update on the issues that they're working with at Lansing. And this is, again, their #1 priority. So I'm looking at it, B and C, and saying, A, I don't know how we can do it legally without, once that plan runs out. And if you're looking at B, B takes effect this coming January after the existing legislation has sunsetted. So I don't know how we can legally continue it. And B, even if there's some way that we could continue it, it would not work in our favor as much as just waiting for Lansing to come up with their answer, which they know they have to do by the end of December. And then we adopt that solution, that new legislation, to be what we will do to be in full compliance with the law. So my question to the attorneys is, A, where did you come from this? How did you come up with this? And on what basis do you think the legal authority lies? And why would it be so different than what the MML is promulgating and trying to accomplish with their attorneys?
Well, let me take a crack at that first, Your Honor, and Mr. Stonehouse. First of all, I don't know what the MML is talking about, but it sounds like you might be talking about the Health Department order that expires on the 8th of December. This language on electronic meetings that we put into this rule is the statute as it exists right now. This is what the statute says. And Matt Curta basically said the same thing. We can meet virtually for no reason at all, any reason through the end of this year. Next year, under the statute, we can only conduct our meetings by electronic means if a commissioner is absent because of military duty, a medical condition, or when a declared statewide or local state of emergency or state of disaster exists, and the personal health or safety of members of the public or commissioners would be at risk if the meeting were held in person. That is the big question. That's really what is confusing here is, what is a medical condition? When is a person at risk? It's pretty nebulous. And I think that's what maybe the lobbyist was getting at when he said there's a little bit of confusion as to what that actually means. But then the next year, starting January 1 of 2022, under the statute, the commissioners may only participate by electronic means if it's due to absence, due to military duty. So that's what the law says right now. The mayor asked us, really for transparency purposes, to put in what the law is so that the citizens of Marquette, the public, don't have to go to the Open Meetings Act and read about how it was amended and what it means. So we put it in here the way it is. Now, if it gets changed next week or the following week, we simply amend the rules. That's That's all we really need to do. We can amend the, change it.
No, I understand we can amend the rules at any time and for,
Right.
you know, at our purpose. But what I'm suggesting is that as we know this rule that's in there, B and C will be deficient based on what the state will likely do, we would be better served by not putting it in and just reacting to what the final guidance is from the state of Michigan that keeps us whole then for the foreseeable future. We seem to be making work and inventing a fix to a solution that really doesn't exist.
Well, just to double back for a second, we have in our rules already that we will comply with the Open Meetings Act. So if we did nothing, we would have a requirement that we comply with the Open Meetings Act. That's how the rule reads before any changes. What I said, the mayor wanted us to lay out how these electronic meetings would be done so that the public would know and the reasons for it. They wouldn't have to wonder why we're doing what we're doing and under what circumstances we're doing them. That's the only reason we put this in.
Again, I understand we're operating under difficult circumstances, but I do think putting something in that we know will change, even though it may serve as a temporary stopgap, really is not moving the process of the rules forward as much as just simply doing it the right way to begin with. And if you certainly, as if we just put a statement in that says we will comply with the OMA, then we answer the mail. And we've showed previously how we comply with the OMA based on electronic meetings, et cetera, et cetera.
I don't have a problem either way, Commissioner Stonehouse. All I said is we were asked to put it in this way. I kind of like it this way because it really tells everyone why we meet and under the circumstances that we meet during these periods of time. Now, the law may change, as you said, and as Mr. Curtis said, that they've got some legislation pending. Whether it actually gets adopted, I don't know, but it may or may not.
Well, let me jump in here because I was the one who asked for it to be put together in this way. So thank you to Ron and Suzanne for putting it together. And maybe I didn't ask for it to be put together the right way. So Fred or Commissioner Stonehouse, I'm sorry. I appreciate your excellent points here. I don't have a problem with changing it to somehow reflect, you know, that we're staying current with the OMA. I wanted for commissioners and for staff and for the public to have transparency as to under what conditions we may be holding Zoom meetings, under what conditions one commissioner maybe is under a quarantine order or is feeling sick and could call in or Zoom into a meeting during this incredibly strange time. And I wanted it to be clear that, you know, if the commission approves the rules, that if myself, I was under a quarantine order, that I may have to call in virtually at some time as mayor. I'm not saying that you all approve that. Maybe you don't, and you say you'd rather have the pro tem there. That would be fine by me. Whatever it is, I want it to be clear and open and out in the public. So good discussion. I see a lot of hands raised. Commissioner Hanley.
I just want to point out this isn't recreating any rules that we're making up. This is exact language from the Open Meetings Act, correct?
This is from the Open Meetings Act. I mean, is it quote?
Okay, I mean, but yeah.
But it's very, very close. These are the main provisions that apply to meetings.
Okay, perfect. So we're not changing anything. We're just going by the actual standards we have right now, which may or may not change, but we have no knowing if that is going to happen for sure.
That's exactly right.
Correct.
Commissioner Mayer, did you have something? I saw your hand raised. I'm sorry.
It was the same question as Commissioner Hanley's.
Commissioner Stonehouse?
Your Honor, I've said my piece. I would only point out that there's a major press conference that they had today at MML, and the thrust of that press conference in large measure is the Open Meetings Act and the critical importance of continuing what we have. And I think by us doing this, we muddy the water, and we have no reason to muddy the water. We will continue to do what the state tells us we can do anyway. So all I'm suggesting is that we give consideration to removing B and C and moving forward and then putting in a new B and C when that becomes palatable, I guess, when they tell us. That's my comment, and I thank you for your time and my opportunity to speak to it.
Appreciate that. Mayor Pro Tem Hill?
I was also at the meeting this morning with the MML, and gave us a fact sheet on the proposed information. They have 3 issues they're actually bringing forward. Yes, Commissioner Stonehouse is holding it up. And in fact, I almost asked to put that on the agenda today. Then we decided to wait because we're waiting on lame duck. Our last meeting in December is December 14th, I believe, right, Kyle?
Yeah, we have 2 in December.
Okay, so the one meeting's on the 14th and then the next one's on the 21st?
Yeah.
Correct.
And so, so we have 2 more opportunities to amend. And I have, and then they could decide to meet after we meet on the 21st, and then we're going to have to go back. And how would we, if the legislature, so 2 things. One is there's a fact sheet that I think it would behoove us to all look at. And then second, and the meeting was recorded as well, if people want to actually watch what happened. And then the second piece is, and this is a question for the attorneys, say lame duck goes past the 21st of December, what, if there is a change, how would we meet in order to address that change?
I can answer that one too, Mayor Pro Tem Hill. First of all, there's no magic in adopting these rules tonight. As you can see from that we've adopted them late in December some years. These rules stay in effect that we're under right now until they're changed. It's just a matter of tradition that when a new commission comes on, we take a look at the rules, and it's more of a, that we do it all the time this way. We could certainly wait and see if this new legislation comes and then adjust it that way, or we could adopt these rules as is tonight and then amend them when the law changes. That would not be a problem. Or we could simply do whatever you want. You can do whatever you want to do. You can do it tonight, you can wait, or you can just simply not do it at all and say, comply with the Open Meetings Act. But I did frankly agree with the mayor that it really is helpful for the public to lay this stuff out. Now, when you talk about Section C, for example, the new law, Open Meetings Law, talks about what happens in 2022. Well, we know next November, we're going to be looking at these rules again. So we put it in there only because that's what the law now says. It doesn't mean that we won't change our rules between now and then. We will probably change them next November, next December anyway. And if the new legislation is adopted, we'll probably change them again. So, you have a number of different avenues that you can take tonight, I think.
Well, it seems like we have a lot of options, and I think honestly any one of them would work. I have no problem with striking B and C or putting something in there on B and C and making a statement that, January 1, 2021 and forward, the commission will continue to follow the Open Meetings Act or whatever that might be. I guess just need a majority of the commission to make that kind of a change. Before we get into any kind of a motion, were there any other sections of this entire rules of procedure that we wanted to think about or address, so that if there were any additional changes we wanted to make, that we could do those all at one time? That might make more sense. I'm seeing no, not really. I seem to remember one, I think Commissioner Davis and I were talking about, there was a word, physically present, that we wanted to see about changing.
I can address that. It just seems real minor, but I know that there was some confusion about physical presence. And so I had 2 very minor editing errors on page 7, under duty to vote, number 3. I would suggest deleting the word physically, so that it just says that the commission is present. And then on page 10 of 10, under physical place, in 1, 2, 3, 4, 5, I think it's line 6, instead of saying which commissioners are physically absent, to strike out physically absent and put in remotely present. So then if they are remotely present, they are physically present, or they're present. And so that kind of matches with the other suggestion. And so just real minor things, because there was some question about that.
I think those are excellent changes, as long as the attorneys think that that doesn't substantially change anything in our rules here.
I think, perhaps Suzanne can address that. I thought the first change was a good one, but the second one, I think maybe Suzanne could address.
Correct. So the first change, Ron and I discussed earlier today, we think that makes a lot of sense regarding the duty to vote, paragraph 3. Because someone who is present remotely is still considered present for voting. And so that does make a lot of sense. The change to the language that is suggested for physical place, as we analyzed that, did not make as much sense, or did not make sense, I should say, from a legal perspective, because we are specifically referring to people who are not in the physical location of the chambers. And this addresses situations where there are people in commissioner chambers and there are people attending remotely. And that sentence does refer to those commissioners that are physically absent due to military duty or medical condition who are being accommodated by remote participation. So it already refers to the remote participation in that same sentence. So that one we thought did not make sense.
I would certainly defer to your expertise. And I guess one other comment is, Mayor, if you're part of your agenda for including all of this language was to educate us, it certainly was successful, because I think every one of us read it in detail and really considered it. I would be fine with whatever option we choose tonight.
Excellent. Thank you, Commissioner Davis. And thanks for bringing up the physically present change. I think it makes a lot of sense. Okay, so any other items on the rules of procedure that we want to address? Commissioner Mayer?
I can get my audio to work here. So the item that I personally want to look at was under section 2, subsection C, consent agenda. Just kind of my thoughts with a couple of the items with that. Looking at something like our resolutions or proclamations, I think, a lot of the time those are more us voicing a support or something, or they're a symbolic gesture. A lot of times proclamations. I wonder if maybe putting those in consent agendas kind of downplays the significance of what we're trying to put a focus on. Putting that in there with the ordinary business items or paying bills, it doesn't seem like that's a good fit for those. But the other thing in the same section is in regards to, bid awards and contracts. For example, one of the things we had on our consent agenda tonight was approving a payment for JCP's previous contract that we awarded a few years back. But even that contract itself, if you look back at the minutes, at the time, Commissioner Reynolds and Conbenzi were opposed to that contract in general. A lot of consent agenda items are supposed to be non-controversial items, but that's not always the case. So that seems a little strange to be in there too, in my own personal opinion, but I'd love to hear everybody else's thoughts.
Commissioner Bonzo?
Yeah, I'll just quickly, concur with Commissioner Mayer. I think that's a valid point. I don't think that we necessarily, would need to change any language in, section 2, subsection C, just to provide ourselves with that flexibility. But I think that, it is an opportune moment to consider what do we put in consent and what do we not. And I agree that perhaps a proclamation, the main purpose of which is to raise awareness, it's sort of self-defeating to put that in a consent agenda. And I also agree that we might want to be a little bit more careful about in the future about how non-controversial the items in the consent agenda actually are, and make sure that the consent agenda is restricted to items on which we can reasonably expect like unanimity. So yeah, I just think it's a valid point to bring up.
Commissioner Stonehouse?
Your Honor, I presume all the commissioners understand they have the authority to pull an item off of the consent agenda at literally their will. So if there's
That's
anything.
what I was going to say the same thing, Commissioner Stonehouse.
We are simpatico then. But that great flexibility is there, and that's the intended purpose of it. If somebody sees something, a bill goes off, I want to look at this differently, you have the authority to so do. And
we've done that, you know, on agenda reviews. I've seen it here, done at meetings. It's been a while. I think I even pulled one, you know, maybe 2 or 3 years ago, but it's rare because a lot of times, you know, you can catch those things in agenda review if you think that they're something that we want to make sure we spend more time discussing. But I hear the sentiment and I understand, but I think that there is an opportunity to pull those things as they, you know, come up. The proclamations, I could go either way. We often will pull them to a new business item so that we can read them aloud. Some of the proclamations are kind of annual, you know, deals that we do regularly. And depending on the night, you know, a night like tonight when we have a pretty full agenda, if we say had, you know, 2 proclamations on there, it adds to the length of time that the meeting lasts. And I'm not sure how much more special that moment is. You know, at 8 o'clock at night, are people still listening for when it's said out loud? But I can understand the point. And like I said, we have had a few where we've pulled them into new business so that we can read them aloud. I'm thinking of a couple in my memory. Mayor Pro Tem Hill?
Yeah, and I just wanted to also say, for transparency's sake, and so people understand, the public understands how it works for us as commissioners, is the agenda is prepared in consultation by the city manager in consultation with 3 commissioners in order to not have a quorum. And there's a meeting called an agenda review that happens on the Friday before the meeting, usually at 7:30 in the morning on Friday. And then the agenda is published after the agenda review. So there's an agenda review, and then that's when the rest of us see it. The rest of us do not see the agenda until after that meeting on Friday afternoon, usually. And then we have the opportunity to consider what's on the agenda, what's on consent agenda. And as Commissioner Stonehouse said, we have the ability, any of us have the ability to ask that it be taken off with a motion. So the process is quick, but it does exist to ask for those changes among the commission members. And there is a review process with 3 commission. It's always the mayor and then 2 commissioners.
Thank you, Mayor Pro Tem Hill, for explaining that. I appreciate some of that background. Commissioner Stonehouse.
Your Honor, let me just give a little bit of historical background to that. We started that process 10 years ago. Previously, the agenda was prepared by the city manager, sometimes with the mayor's assistance, sometimes not. But 10 years ago, we wanted additional input to it. We wanted better ability to manage what was coming on the agenda, how it was treated and where it was placed. So we came up with a revolving system of 2 commissioners plus the mayor at the agenda preparation period. And that's what we're seeing now, and it has been working, I think, extraordinarily well. Enough comments.
I would agree. And it's a nice chance for commissioners to ask questions and kind of be prepared ahead of the meeting, and it rotates, so folks get a turn at asking, you know, for a little bit more background or having, you know, more maps or whatever the request may be. Or, you know, we've moved things from consent to new business. We've pushed things to a future date until we can get more information, and those agenda review, agenda preparation meetings are the perfect time to do that. But if you're a commissioner who isn't sitting on that meeting and you open up your packet on, you know, Friday afternoon and you say, ooh, this item is really, this should be new business, you know, you simply send a message, and we're happy to make that happen, obviously with a motion on during the meeting. So we could, you know, if you feel like you want to make a motion on that, Commissioner Mary, you're welcome to do so. Go ahead. It looks like you've got your hand up.
I was just going to say something briefly. Just to clarify, I was aware that that was something I could do with really any agenda item that's on the consent agenda. I guess one nice thing of this being in this packet, I believe it was some 363 pages, and reading all of it, is that all of those rules did come up, obviously, because this is in here. But it was just something that personally it seemed strange to me, so I was curious what everyone else thought about it. Thank you for everybody's feedback.
Member Temple.
I have a possible compromise on the electronic meetings question, as I was thinking about what the concerns that Commissioner Stonehouse raised and the interest in making sure that we're transparent about how meetings actually work. So would the language, it's my understanding that the language that's in 6B and C is what is in the current statute as is written. So could we just move that into A and have A hold all that information, and then with the idea that we all understand that probably in December we're going to be revisiting this to include what the new language would be. So strike the headline for B and C, but the actual content would be included then, because I agree, I think there's really value in the transparency of how it works. As someone who personally, I had to go into quarantine. My family member was contact traced. So these situations are going to keep coming up, and so I really appreciated having that right there.
I think that would also work, Mayor Pro Tem Hill. I think we're at a point where it seems like we've got enough of a consensus to take a vote. I would ask that whoever makes a motion that they might consider page 7. Commissioner Davis had mentioned striking the word physically from item E3, just to remind us of the conversation that we've had. And then question mark as to what we do about section 6, but I think a number of options were laid out, and I think any one of them would work just fine. So commissioners, let's go ahead and do we have anyone willing to make a motion on the rules of procedure here? Mayor Pro Tem Hill?
I'll try. So I move that we amend the rules of procedures to include the proposed change on page 7 regarding duty to vote being present and striking the word physically. I move that we amend section 6, that the language in B and C be included in A, and I do believe those are the changes that we have on the table from the conversation we've had.
And did you want to add a clause in there to revisit this, or?
Oh, thank you. Yeah, and that we will revisit with the expectation that in this as soon as we have further guidance from the state regarding amendments to the Open Meetings Act by the state. How'd I do, Kyle?
Can I ask a clarification?
Yes.
So you want to remove the headings from B and C in section 6. So the heading then for a large section A is just going to say prior to January 1st, 2021. So you would need to change that heading too, I believe.
I think so, right? Is that right, attorneys? That I was just trying to make sure it was all there. That's all.
I think I understand what you're trying to do, and you could certainly combine those 3 paragraphs into one section. But the second, for example, would only be applicable starting January 1 through the end of the year.
Oh, I see. I'm sorry. I misunderstood. I thought that was all what was currently required.
No, A is all.
I fundamentally misunderstood. Sorry, this is happening in the middle of a motion. Okay. Well, that doesn't. Yeah, sorry. Go. Yeah, I withdraw.
Withdraw your motion.
Yeah. Let somebody else give it a shot. Sorry.
Commissioner Bonzo, you want to give it a whirl here?
Well, no, actually, just as a point of order, just to make sure here, I don't think that we ever formally left we suspended the rules for discussion. I don't think we ever formally reinstated them.
Do we have to reinstate?
I don't remember whether we do or not. I just wanted to make sure we're okay.
We generally don't make a motion to reinstate if there's a consensus. I mean, you could do it, a move to close the discussion and take a vote on that. But typically, the commission doesn't if there's a consensus. I guess that's.
I don't remember doing one, but that doesn't mean that what we've done in the past was right. So it's a good question, Commissioner Bonzo.
Yeah, generally we have not. We just move. Someone eventually will make the motion, and then the motion.
Right.
Go. You don't have to. I mean, the orders are brought back in making a motion.
Okay. I'll defer to somebody else that wants to make this increasingly complicated motion.
Commissioner Stonehouse, you're our guy. Come on. You're on mute, though. You're going to have to unmute. We can't hear you. Commissioner Stonehouse, you're going to have to unmute. We can't hear you. I'm sorry.
Good point. My comment was I threw the hand grenade that started this all going. So let me try.
Here we go.
Let me try and make amends here. I move to accept the rules as written with the changes as suggested by Commissioner Davis.
Okay, so look at you, how succinct that was. City Clerk, do you have what you need?
Yes.
Do we have a second on this motion? Commissioner Davis.
I will second that motion.
Discussion, Commissioner Stonehouse.
No discussion, Your Honor. I think the relative points have been made, and I'm sure that the attorneys will catch whatever changes come out of Lansing.
Wonderful. Commissioner Davis, any discussion?
No, I agree that everything that needs to be said has been said, and that we will probably see some changes in the near future.
All right. Any other discussion from the commission? All in favor, please say yes.
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 All opposed, please say no. Motion passes 7-0. All right. I think we are moving on to some easier items. Item number 8, Marquette County Central Dispatch Policy Board appointment. City Clerk, could you please read the background?
Thank you, Mayor. The Marquette County Central Dispatch Policy Board has an upcoming vacancy due to the completion of former Commissioner Peter Frazier's term with the board. In the past, the City Commission has typically appointed one of their own members to serve as the Marquette City designee on this board. Past City Commission members who have served typically have had transportation, law enforcement, or fleet management response experience. Fiscal effect, none. Recommendation, authorize the mayor to nominate one commissioner to serve as the city's representative on the Marquette County Central Dispatch Policy Board for a term ending December 31st, 2023. Alternatives as determined by the commission.
Thank you. Commissioners, do we have a motion? Commissioner Bonzo?
I move that we authorize the mayor to nominate one commissioner to serve as the city's representative on the Marquette County Central Dispatch Policy Board for a term ending December 31st, 2023.
And Commissioner Mayer?
I'll second that motion.
Commissioner Bonzo, any discussion?
Nope. I trust you to appoint somebody who will do a good job.
And Commissioner Mayer?
Thank you.
Any other discussion? All right, all in favor, please say yes.
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 All opposed, please say no. Motion passes 7-0. And just a note that I do intend on appointing Commissioner Hanley for this role. She has experience as a first responder on a department in Houghton County and has experience working with Central Dispatch, and she was the only commissioner who approached me and had a very enthusiastic message to me about her interest in this role, and I think she'll do a nice job. So we will make sure that she gets set up and reports back to the commission regularly with any updates. Appreciate that. All right, so moving on to number 9 under new business, Native American Heritage Fund Grant Award. City Clerk, could we please have the background?
I'll even unmute myself. The city's Community Services, Arts and Culture Division has been awarded funding from the Native American Heritage Fund, the NAHF, totaling $57,500 to interpret Indigenous history from the mouth of the Carp River to Presque Isle through signage and public art inspired by Anishinaabe history and heritage. The funds will also be applied toward development of a companion trail curriculum to assist in telling the story of Native history and culture in our community. This project is a part of a larger cultural trail initiative that will span the city's 2-mile multi-use path along the lakeshore. The cultural trail will transform the existing path into a destination, telling a full history of our community and its centerpiece, Lake Superior. There is virtually no interpretation along the shore that connects, honors, and gives voice to the multiple stories, places, and natural features along the lakeshore. Well-traveled, the multi-use path will be a catalyst for dialogue and an opportunity for the community to reflect on the past, the present, and the future. The Greater Cultural Trail Project will include all our history, the pre-Indigenous experience, the Anishinaabe experience, the early settler and immigrant experience, and the experiences of those living here today. Fiscal effect, the Arts and Culture Division will receive $57,500 toward this project. Matching dollars for the project come from approved fiscal year 2021 budgets for the Arts and Culture Division and the Marquette Public Art Commission. This will include Arts and Culture Division in-kind administrative wages and Marquette Public Art Commission project funding equaling $30,000. Recommendation, approve the grant award from the Michigan Native American Heritage Fund grant and authorize the city manager or designee to sign any required future grant agreement. Alternatives as determined by the commission.
Commissioners, do we have a motion? Mayor Pro Tem Hill?
I move that we approve the grant award from the Michigan Native American Heritage Fund and authorize the city manager or designee to sign the required future grant agreement.
And do we have a second? Commissioner Mayer?
Second.
Pro Tem Hill, any discussion?
As a member of the Public Art Task Force and the founding of the Public Art Commission, this is exactly what we were working towards now 3-4 years ago, to have the capacity to be able to take on a project like this and to have the matching funds available so that we could start to recognize the rich history and the multiple cultures that we have in our community, Indigenous and settler, and I'm really excited that we've been able to move so quickly to make this happen. Kudos to the staff who I know who have been on the call. Thank you very much to the Arts and Culture Center staff and to the Public Art Commission members.
Thank you. Commissioner Mayer, discussion?
Just as a member of the Indigenous community, I'm very thankful and grateful that this is something that's come up on the agenda that I get the opportunity to vote on, and I'm very glad that we're able to do this. That's all.
Any other commissioners? Commissioner Stonehouse?
Yes, Your Honor. Long time coming. I think I once a few meetings ago told folks that we've been looking at this for 20 years. 20 years. So it's nice to see it finally get to the stage and to the point that we can begin to do something. Very proud of the city for what they put together on it. Very proud as to how they were able to assemble the funding on it. And I look forward to what will come out of this great project. I think folks everywhere are going to like it. I think our citizens are going to learn more about who they are and their community than perhaps they ever knew. And that's really the great value in this, is learning more about ourselves. So thank you, Your Honor.
Commissioner Bonzo?
Yeah, thank you, Madam Mayor. I just also wanted to say I'm very excited about it. I'm very grateful to everybody, to the city staff, to everybody on the Arts and Culture Advisory Committee and the Public Art Commission. And I'm really confident that they will do a great job of, having an accurate, well-researched, interesting, and engaging, set of interpretation along the cultural trail. I think it's awesome that we're able to really elevate the Indigenous history of our community and Anishinaabe voices in the community, and that we'll be doing a good job of engaging with Anishinaabe residents who are experts, on this history that often is so overlooked. So I'm really excited about it, and I'm really happy to vote for this.
Other commissioners? Commissioner Mayer?
Sorry, I just have one more thing to add. Growing up, this wasn't a big thing in my culture. Even growing up in a city that had a reservation in it, there wasn't a big thing that was taught to the youth, the next generation, this kind of aspect in this history. And it's really awesome that this is going to be something in Marquette that new generations can look at and learn from, and just even our current residents as well. It's really awesome. That's all.
Certainly something that we can all be proud of and be glad to be able to take a vote on. There are a lot of things the city does that we are proud of and grateful for, but this is something that it's going to be very visible in our community, to both our residents and our tourists. And I think it's going to be one of those, jewels on the crown of Marquette, and I'm looking forward to seeing it come together. And I'm very glad that we're able to honor the Native American history this way as well. So thank you to city staff and to the committees who have been working on this for a very long time. Sounds like 20 plus years of work in the making, and I hope to see more projects like this in the works in the years to come. And you all just let us know how we can help you get there. All right, let's go ahead and take a vote. All in favor, please say yes.
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 All opposed, please say no. Motion passes 7-0. Item number 10, Michigan Council for Arts and Culture Affairs Grant Award. City Clerk, could we please have the background?
Thank you, Mayor. Community Services Arts and Culture Division has been awarded a project grant totaling $9,940 by the Michigan Council for Arts and Cultural Affairs, MCACA, for Art Week, a week-long free celebration of arts and culture featuring concerts, theatrical and dance performances, demonstrations, workshops, community art projects, public art installations, street performers, exhibits, pop-up art shows, downtown art stroll, studio tours, a plein air painting festival, a chalk art festival, and more. Now in its 6th year, Art Week has become the kickoff to Marquette's summer event season. MCACA funding will be used to strengthen current programming and add additional community art projects and performances scheduled for June 20th to the 26th, 2021. Arts and Culture staff coordinates and promotes the entire event, a collaborative effort with over 60 local arts and culture organizations and work by over 200 artists. 24 featured events and many independent pop-up events are attended by 2,000 each year, and that number is growing. Like all summer events in our city, Art Week was canceled in 2020 due to the COVID-19 pandemic. The festival will provide a platform for Marquette residents and neighbors to connect and celebrate after experiencing one of the most challenging years in our history. Additional funding will be used to strengthen current programming and add additional community art projects and performances. Due to COVID, Art Week will focus on exclusively outdoor and socially distanced events and programs. And then there's a quote from Andrew Lacombe with the Marquette Symphony. Art Week is a vital showcase to the Marquette community, and the organizational support we get from the city of Marquette sends a strong message to us and other growing nonprofit organizations. And then Andrea Ingmeyer with the Peter White Public Library is quoted as saying, Art Week engages our community in a way that other events do not. This event provides arts exposure to all age and socioeconomic groups. It is not a sales event. It is an opportunity to experience and participate in the arts. I believe Art Week is one of the most important events in Marquette. Fiscal effect, the grant match is $9,940 and is included in the fiscal year 2021 budget. Recommendation, approve the grant award for the Michigan Council for Arts and Cultural Affairs project grant and authorize the city manager or his designee to sign the grant agreement. Alternatives as determined by the commission.
Thank you. Commissioners, do we have a motion? Commissioner Bonzo?
Thank you, Madam Mayor. I move that we approve the grant award for the Michigan Council for Arts and Cultural Affairs project grant and authorize the city manager or his designee to sign the grant agreement.
Do we have a second? Commissioner Hanley?
I second that motion.
Commissioner Bonzo, any discussion?
Nope, I just think it's a great thing for the city. Financially, it's a tiny drop in the bucket that will go a long way.
Commissioner Hanley, anything to add?
I feel the same. Arts are something that help everyone. And I think we need to do everything we can to encourage them in our city.
Other commissioners? All in favor, please say yes.
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 Yes. All opposed, please say no. Motion passes 7-0. Brings us to our second public comment session of the evening. Public comments may not exceed 3 minutes per person. Please clearly state your name and physical address. Do we have anyone for public comment?
We do not.
All right, seeing as we have no one for public comment is now closed. Brings us to comments from the commission. As an FYI for the commission, I intend to begin commissioner comments in alphabetical order tonight, and then each meeting thereafter start one further down the line. So for example, tonight Commissioner Bonzo will start us off, ending with Commissioner Stonehouse and then myself. Next meeting, which is tomorrow night, we have a work session. Commissioner Davis will start us off, and we'll go down the line, ending with Commissioner Bonzo and then myself, just so you have an idea of how I intend to do that. I just tried to keep everyone guessing last year, but I'm not going to do that to you all again. So I may get it mixed up from time to time, but that's my intention, all right? So you can kind of tell, I mean, you're not here physically, but I'll be trying to go down the line. Wherever I start, I'll just keep going. So, Commissioner Bonzo, go ahead and start us off.
Thank you, Madam Mayor. I think that makes sense. It was a long meeting tonight, but I think it was very productive. There were a lot of very positive things that we learned about that will benefit our community. I did want to just make two quick comments. First of all, recentering that information we heard at the beginning of the meeting, which might seem like a long time ago now, but in my opinion is actually the most important part of our entire meeting tonight, was the hour that we spent discussing COVID-19, the current situation in the community with COVID-19 and the community spread we're seeing, the issues with hospital capacity that we're seeing. And I just really want to reiterate that there's a reason that we're meeting virtually tonight. And I really hope that all residents of the city of Marquette will continue to strictly comply with the restrictions that have been put in place by the state of Michigan. As our folks from the county health department said, such restrictions are effective, but only if people actually comply with them. So just want to recenter that and also reiterate that I think we need to begin preparing now. We're nearly into the month of December. We need to begin preparing now for what we are going to have to do to help the county health department administer the distribution of the vaccine, educate the public about the vaccine, because as they also noted, it could be as soon as early January that we hit that phase 1B, where large numbers, a large amount of the general public is going to actually begin receiving that vaccine, and it's going to really need to be an all hands on deck effort. The city certainly will need to be part of that to some greater or lesser extent. And then the second thing, I just want to remind everybody, this is a positive thing, that we're going to be seeing glass recycling coming back to the city very, very soon for the first time in almost a decade. At least since 2012, glass hasn't actually been recycled in the city of Marquette, but now it's going to be. So really excited about that. The first full week of each month will be glass recycling week, with other recyclables recycled in the other weeks. You can see on my Facebook page or many of my colleagues' Facebook pages, on the city Facebook page, the schedule for 2021 for recycling. I'm really excited to see next week us, finally get back on track with that. It's an issue. When I was knocking doors last year, when I was campaigning, one of the top 5 things for sure was glass recycling. So I think this is a really, really great achievement for the city and for the entire county to be able to make this possible. And, we're there, we got across the finish line.
Great, thank you. Commissioner Davis.
Well, I will join Commissioner Bonzo in being excited about glass recycling, because that was where some of my comments were going to be also. So I'll leave it at that. But I do want to recognize the Downtown Development Authority for their year-long work on developing their strategic plan. It's a nice guide for our future growth and development, and will serve as a foundation for a lot of our decision-making. I particularly appreciate the emphasis on the sustainable community, a diverse tax base, mixed use and housing, transportation, connection to the waterfront, and infrastructure needs. So many thanks to those who were involved in that development of the plan. And then finally, tomorrow is Giving Tuesday. And our nonprofits have been hurting this year. So if you do have the means to do something about Giving Tuesday, I would highly encourage you to take a look at your favorite nonprofits and give. Thank you.
And moving on to Commissioner Hanley.
Hi, Giving Tuesday was my main point actually as well. Sally hit the nail on the head when Commissioner Davis did when she said that our nonprofits have been hit. The Children's Museum being one of the biggest ones, they still do things that they can to try and reach out to the kids in our community, like their Book Your Bubble that they're doing now without very little to any profit for them. And we need to try and help them to make sure that our community continues to have these awesome things for the years to come. Another thing I would like to point out is not only are our nonprofits being hit right now, but our local businesses are being hit. A lot of our restaurants in the area being closed has really caused them a problem during this time. And with little to no support from anyone else, we need to try and look and help them as much as we can. So if you have the ability to order to go from your local restaurants that are doing it, and if they aren't doing to go, to buy gift cards from them to give away for Christmas if you can. I know that a lot of us are strapped at this time because a lot of people are out of jobs, but if you can, your local business owners will really appreciate you doing that. Thank you.
Mayor Pro Tem Hill.
Thank you. I echo the comments that were made earlier about the COVID information we received. Giving Tuesday, which is an opportunity to give back to the different amazing groups we have in our community, and the absolute needed. Those were all the points on my list. And glass recycling. So good job, everybody. The only thing I have to add is that Thursday night, December 3rd, the Downtown Development Authority is going to have a drive-by visit with Santa. So, and we're going to light the tree. So that's going to be from 6 to 8 p.m. I may or may not wear my dancing tree hat. It depends on how long the battery goes, but I do have this. My mom loves those kind of things. So my whole family has dancing tree hats, actually. So we will have that to look forward to. And I'm way over 6 feet tall when I have that thing on my head. And so that's really fun. So yeah, some levity in this time. I want to thank everyone. Certainly folks in my neighborhood have their Christmas lights up, and I know folks have been getting out and going to see them. It's been really wonderful to have all that up. I am fully in favor of having those up until like solstice. I'm on for March for me to leave them up, but let's all plan on doing that and in this time, as we do need to mask up and be safe, because I did have the experience over the holiday weekend. A friend ended up having to wait for emergency surgery for 48 hours at the hospital and was cared for, but was not able to go in for surgery because of the need to wait for staffing. Everything turned out fine in the end, but we are in a very serious situation, as we heard earlier. So let's bring the joy where we can at this time of darkness and hibernation, but let's all please be safe. Thank you.
Commissioner Mayer?
Righty. You know, it's kind of hard to not reiterate some of the things that everyone else has mentioned, because all of it's important, but I'll try to not repeat anything here. The thing about the lights, though, I must say, my wife and I try to still go on daily walks to get out of the house with our 9-month-old, and she thinks the lights on people's houses are the most magical thing in the world. So that's always brightens my day when she gets to go out and look at those. Appreciate everyone, this meeting that we just had, and you know, I'm looking forward to our work session. Nothing gets me more excited than economic policy, so I'm genuinely pretty pumped up about that. But good meeting, everyone.
And Commissioner Stonehouse.
Yes, Your Honor, thank you. Couple of things just to hit on very quickly here. Obviously, as the health department told us, we're going to be in for a very scary few months here, and people need to be very much aware of that. But they also need to understand that the majority of the people that are getting infected are really occurring through community spread. And that means families, that means friends, that means people doing everything they're told not to do in terms of masking, washing their hands, social distance. That's what's driving this thing right now. And again, that's the experts that are telling us that. But talking too about COVID, I attended, as did the Mayor Pro Tem, virtually the Michigan Municipal League's conference this morning on the Michigan Community Stabilization Plan that they'll be launching with Lansing, trying to get some aid for our cities. Because the problem that's coming out of COVIS is really, they're referring to it as the tail of COVIS. We're going to get through this winter. We're going to get the vaccine. We're going to think we put COVIS behind us, but it's going to have this tail that's still hanging there, and it's going to be a financial tail. For example, there's 22 cities in Michigan that have a city income tax, and that can be a desirable thing. Residents pay a given percentage, people that work in the city pay another percentage on besides that. But with a city income tax, if you're working in the city, you're paying that tax to the city. If, however, you are working at home and that home is not within the municipality, that tax is not being paid to the city. That tax just kind of disappears. That money that you would theoretically owe if you were employed in that particular municipality. So what that means is those cities will be losing, they're estimating somewhere around $250 million this coming year. That's a serious issue for those guys. But what can become a serious issue for us are the institutions that may be employing people in the city and have sent them home to work. And are now working out of their home, because now that institution that we're working for, that suite of offices, has just changed its tax value. It now has the ability to go in and plead its case for lower taxation. In other words, business taxes and property taxes, and how that would in turn affect the city. And we are part of that. We potentially would be open for that. So that tail of COVID becomes far more different and something we don't often think about, or will not be thinking about, until we finally get the disease behind us. But I wish everybody a good, safe couple of weeks until we meet again. And please remember what you've got to do to fight the COVID. Thank you, Your Honor.
Thank you. So first of all, I just wanted to, take a moment to say how sad I was to hear about the passing of Tom Casperson. I worked with Senator Casperson several years ago in my role at Michigan Works. And at the time, his office was the first elected official's office that I visited in Lansing. And it was incredible to see the passion and drive he had to help Yoopers, the number of things he had in his office, the plaid and the little Yooper wooden, things made at lumber mills, and just kind of the smile on his face when he talked about, his community, and his community was, his whole region. So he will be dearly missed. And I know that we're all thinking of his family. It's always difficult when someone passes, but I think this one was extra hard, especially right now with COVID and the fact that those folks may not be able to gather and properly mourn him. So just thinking of him right now and his family. A couple other things that were touched on, but I wanted to make sure to talk about again. We do have a work session tomorrow evening. It is on Zoom, so anyone watching remotely, you can tune in and watch just like you did tonight. Our work session will be on economic development. It will be an overview of kind of things that we've had happening in the city and the things that, maybe to come. That will be at 5:15. Details are on the City of Marquette website to go ahead and get logged in. And then Mayor Pro Tem Hill mentioned the downtown Marquette holiday parade with Santa on Thursday from 6 to 8 p.m. at the Marquette Commons. Again, you can drive by. Children can bring a letter for Santa that the post office will be picking up and delivering to Santa. My 4-year-old has not decided what she wants for Christmas yet. There are far too many options. And my husband, I keep saying that we need to find things to give to other people too. So we're focusing on that this year. But kids can bring letters for Santa to drop off in a distanced, safe way. And Santa will be there. I have heard a rumor that the Grinch may be there and has been eyeing up unplugging that Christmas tree. So if you happen to drive through, it might be kind of fun. I'll be there along with Mayor Pro Tem Hill, and I'd be glad to see anyone that would like to drive by, whether they are a kid or not. All are welcome. So looking forward to that, kind of like a reverse holiday parade, they're calling it, because the parade is actually kind of the cars moving through, but there's kind of a static display and waving. All right, so that's that. That's what I had for tonight because the commissioners covered everything else so well. I'm also very excited about glass recycling, but I won't keep talking about that forever. I finally have somewhere to put all my wine bottles. All right, brings us to comments from the city manager. Do you have anything for us tonight, Mike?
Nothing tonight, Your Honor. Thank you.
He says nothing tonight. All right, we are adjourned at 8:43 p.m.